This Council resumes the second reading debate on the Tobacco Control Legislation Amendment Bill 2025. Honourable Holden Chow, Chairman of the Bills Committee on the bill, will first address the Council on the committee's report. Mr. Chow. President, in my capacity as Chairman of the Bills Committee, I submit the report. The bill seeks to implement 8 tobacco control measures. Namely, A. Implement a duty stamp regime for tobacco. Cigarettes sold at a price lower than the tobacco duty are presumed to be duty not paid. B. Increase the penalties for offences relating to duty not paid tobacco. C. Prohibit the possession of specified alternative smoking products ASPs. D. Adjust the packaging requirements for conventional smoking products CSPs. E. Prohibit smoking while queuing to board public transport carriers or to enter certain places, or while staying in the delineated areas for designated boarding locations. E. Extend statutory no-smoking areas NSAs and increase the fixed penalties for smoking-related offences. G. Prohibit the provision of CSPs or ASPs to underage persons. H. Prohibit the sale of flavoured cigarettes. The Bills Committee has held 8 meetings with the administration. Majority of members support the bill for the implementation of these measures. However, some members do not support individual measures such as the ban on sale of flavoured cigarettes. Given that the bill requires duty-paid cigarettes to be affixed with stamps on the packets, some members are concerned about the possibility that people will collect and reuse stamped cigarette packets to use them for loose cigarettes. And there may be stamped cigarette packets for sale online. Members are also concerned about the shift to the sale of loose cigarettes. The administration explains that it is an offence to reuse or distribute duty stamps without the consent of the Commissioner of Customs and Excise, cut off duty stamps and affix them to other packages, counterfeit duty stamps, or affix counterfeits of duty stamps to cigarette packets. Smoking Public Health Ordinance Cap 371 provides that tobacco products intended for sale must be in a packet of at least 20 cigarettes. In other words, loose cigarettes must not be sold. In relation to the prohibition on provision of CSPs and ASPs to persons under the age of 18, the administration will, in response to members' views, propose amendments to advance the commencement of the provisions to the day on which the enacted ordinance is published in the Gazette. Commencement of the relevant provisions relating to fixed penalty will also be advanced to the same day. Under the bill, possession of ASPs, including e-liquid capsules, heat sticks, and herbal cigarettes, is an offence. The Bills Committee asks the administration to clarify the definition of public place so the public will not be caught by the law unwittingly. The administration points out that Cap 371 already provides a definition of public place which is similar to that in many ordinances. The proposed prohibition on possession of ASP substances in public places under the bill will adopt the same definition of public place in the existing Cap 371. As regards the interpretation and application of any place to which, for the time being, the public are entitled or permitted to have access, whether on payment or otherwise, in the definition of public place under Cap 371, the fundamental principle established by the court is that a public place must be a place that allows members of the public to enter in their capacity as members of the public, rather than in a private capacity. According to this common law principle, whether a place is regarded as a public place under Cap 371 depends on the specific circumstances and details of each case and must be determined having regard to the legislative intent of Cap 371. Given that the administration has made reference to the practice of Canada and other countries in making the proposal to prohibit the sale of CSPs containing specified additives, the Bills Committee requests the administration to advise the relevant practice. The administration points out that the ban on flavoured tobacco products in Canada has been enforced since 2009. It clearly lists out the prohibited substances and exempted substances, mainly those necessary in the manufacturing process of tobacco products as humectants and preservatives. When the authority of Canada identifies products that contain prohibited additives, they can take corresponding measures, including publishing notices of non-compliant products, issue warning letters, seizing the products, or initiate legal proceedings. According to public information, all tobacco practitioners in Canada comply with the regulations. While there has been isolated cases of non-compliance with the issuance of warning letters, the relevant tobacco has fulfilled requirements. The mechanism in Canada effectively bans flavored cigarettes without hindering the sale of non-flavored ones in the local market, and has been recognized by WHO as one of the best practices for implementing the ban. The administration explains that the proposed ban on flavored cigarettes under the bill prohibits additives based on the regulatory framework of Canada. The term additives indicates ingredients added to another substance. The specified additives under the proposed new schedule includes those that can modify or enhance flavors of the smoke generated from CSPs concerned or otherwise have flavoring properties. Therefore, the ban on flavored cigarettes does not contain naturally occurring ingredients in tobacco leaves. The administration emphasized that, like in Canada and Australia, Schedule 10 also exempts substances necessary in the manufacturing process. Based on the experience of Canada during the first phase of the ban, even if tobacco products contain menthol or exempted substances, they can still be sold in Hong Kong so long as they do not contain other additives. In response to members' comments on providing a clearer regulatory framework, the administration will propose amendments to Part 1 of the proposed new Schedule 10 to bring its presentation more in line with the Canadian regulations. In addition, 2 menthol-related substances will be added to Part 2 of Schedule 10 to facilitate the implementation of the ban on non-menthol-flavored cigarettes in the first phase, making the provisions clearer and facilitating operation. In view of members' comments, the administration will also move other amendments which are supported by members. The Bills Committee will not move any other amendments. Mr. Peter SHIU indicates that he will move amendments in his personal capacity on the commencement arrangements, subsidiary legislation in respect of packaging requirements of conventional smoking products and the certification regime, as well as the definition of specified additives for the proposed ban on the sale of flavored cigarettes. Mr. Chun-keung also indicates that he has submitted other amendments to the President to abolish the ban on sale of flavored cigarettes. The committee has completed the scrutiny of the bill. Details can be found in the report. President, I now speak in my personal capacity. I was the chairperson of the Bills Committee. The committee has held 8 meetings. I thank members for their work in having in-depth discussions. And there were times when we did not see eye to eye, but still we have engage in fruitful discussion to get a better understanding of the matter. We've also received detailed explanations from the administration. There are a number of issues that have been brought up. Members are concerned about the expansion on statutory no smoking areas, NSAs. We want to step up the measures so that children will be protected from secondhand smoke. In addition to queuing for public transport, 3 meters from schools are also NSAs. These are measures to protect our children. We've spent quite some time on discussing these matters. We've also touched on one issue. Well, will there be drugs added to cigarettes? Say, for example, etomidate. We wonder if drugs are added to e-cigarettes. We asked how the administration will take enforcement action. We've raised these concerns. The administration has given explanations about further regulations. There was a discussion about possession of ASPs in public places. The administration, citing court cases, elaborated on the definition of public place. I've already mentioned about this in my report. Perhaps we can hear further from the Secretary about the definition of public place. It's not complicated. Well, say, for example, there is an occasion when guests are invited to see some displays of tobacco products. My understanding is that this is not defined as a public place. It was discussed in the Bills Committee. Perhaps the Secretary will elaborate. There is another topic that's been hotly discussed: substance in cigarettes. Certain substances are either banned or exempted in the schedule. I recall that in the deliberation, some members mentioned that if there is a ban on certain substances, would it cause CSPs to be completely banned? I remember that there has been numerous discussions on this as well. I asked the Secretary to explain further. We want to make sure that the sale of CSPs will not be affected even with the ban on flavored cigarettes. We don't want CSPs that is already available in the market to disappear. Perhaps the Secretary in the second reading will elaborate further. There is an amendment in relation to the list of exempted substance. I think members are seeking reassurances. The measures on the ban of flavored cigarettes should not affect the sale of CSPs. We await for the explanation from the Secretary. We just want to get some reassurance. Members have been very serious in the scrutiny of the bill. There have been constructive questions asked, to which the administration have answered. Perhaps the issues brought up by members will be further explained by the Secretary. This is to dispel public concern. We want to control tobacco or smoking for health reasons. We need to do it. It's something that members recognize. But a balance needs to be struck. We don't want to affect our economic activities, business operations. I've already outlined the issues brought up in the committee. I speak in support of the bill.
Mr. Lim Chun-keung. Thank you, President. For many years in a row, Hong Kong is ranked one of the places in the world with the longest longevity. According to a 2021 Hong Kong Youth survey, the low smoking rate is one of the major reasons why we have long longevity. And Singapore, compared with Singapore and Japan, and we have the lowest smoking rate, we have the lowest mortality rate of diseases stemming from smoking. So tobacco control should be one of our major works. For male aged between 40 to 59, they are the high-risk groups for 3 highs. However, a lot of them have not joined the chronic co-management illness disease program. So we can't rule out the possibility that we have more underlying cases of chronic illnesses in Hong Kong. With better tobacco control, we will be able to reduce healthcare costs as well as economic loss. We can also alleviate the strain on our healthcare system. So this bill will ensure sustainable development of our healthcare system. Coming back to the bill, there are three major targets. First, lowering the supply of smoking products. Relevant measures include duty stamp system for cigarettes, as well as combating illicit cigarettes. In future, cigarettes products will have to be affixed with a duty stamp to prove that it is duty paid. Otherwise, the relevant products will be presumed as illicit cigarettes. The highest penalty for selling illicit cigarettes will be increased to $2 million of fine and 7 years of imprisonment. The above measures is to help frontline officers identify duty-paid cigarettes and duty-not-paid cigarettes. There is also a need, however, for the government to enhance law enforcement actions across the boundary. To address the problem at source, there should be strengthened intelligence gathering at the community, and we should curb sales of illicit cigarettes that make use of order sheets. Some unscrupulous elements may reuse cigarette packaging with the duty stamp affixed to confuse people, so we have to keep updating our measures to address the loophole. To prevent the public from being affected by secondhand smoke, Part 6 of the bill stipulates that no smoking will be allowed while queuing to board public transport carriers, and no smoking areas will be extended to childcare centers, schools, and hospitals. And these are known as the 3-meter distance outside premises. However, I'm concerned about the details. For example, we won't use a ruler to measure whether the distance is within 3 meters outside the premises. And how can we delineate the boarding area? And if we go 2 steps further, would that be included as part of the queuing area? There might be disputes. Frontline officers, there are about just 100 of them under TACO. The health department in recent years has been saying that it will review the establishment and manpower needs, and in accordance with the established mechanism, it will ask for more resources. However, the civil service establishment has been capped at 0 in terms of its growth. Even if there are complaints in the future, there may not be officers to deal with the complaints. So will these new rules become toothless tiger? What is encouraging is that the Department of Health announced recently that officers from TACO will wear portable cameras with them when enforcing the law. So I believe this will help ensure safety of the frontline officers. We hope that more law enforcement officers will be equipped with such new cameras. The third target of this bill is to prevent flavorings from being added to conventional smoking products, which may cover the harshness of smoke of these products to prevent young people from getting addicted to smoking. The additives under Schedule 10 may help cover the harshness of smoke. According to the definition of the bill, they do not cover the substances that naturally occur in smoking products. So when the authorities make inspection, it will have to take note of this. It will have to analyze the chemical structure of the substances to decide whether the relevant substances are artificially added. It should not adopt a broad brush approach and ban all kinds of substances. Also in Schedule 10, for vegetable extracts as well as starch and nutrients as well as all other 18 substances will be exempted from the additives list. We believe that this has taken into consideration the needs of manufacturing smoking products, and This will not affect the normal import and supply of cigarette products. I so submit I support the bill. Dr. Chun-keung. Deputy President, I support an effective tobacco control measures for one simple reason. Smoking is harmful to our purse as well as to our wealth. We don't want to see our relatives leaving this world because of smoking. So this bill deserves our support according to studies. There are over 7,000 chemical substances in cigarettes. Over 70 of them are carcinogenic. Around the world, 8 out of 16 heart-related diseases have to do with smoking. If we get secondhand smoke all the time, you will be subject to a high risk of contracting these diseases. According to the WHO, every year there are about 7 million people who die of smoking, and 1.6 million of that, that's 1/5 of them, died because of secondhand smoke. According to local studies, in 2021, about 4,600 death cases had to do with smoking. For cities around the world, tobacco control is not just a public health problem, but also an ethical issue. The government has put forth 10 tobacco control strategies. Here are my personal views. I think this is out of a good intent. We are not completely banning smoking. It's just that the relevant measures may cause inconvenience to smokers. We are sacrificing the interests of a minority group of people, but we're benefiting the majority. There are some measures. For example, we're banning smoking while queuing. There will be an extension of no smoking areas, and we are enhancing the penalty of illegal smoking. On banning smoking while queuing to board public transport and in designated premises, this is one of the measures. Second, the government is also extending the no smoking areas, and no smoking will be allowed within 3-meter area of designated premises, including schools and hospitals. And the penalty will increase from $1,000 to $3,000 as the penalty. Most people know that they should not smoke in these areas. It's not hard to enact legislation. What matters is how we can enforce the law. While queuing, we should control ourselves not to smoke. The bill is indirectly protecting social order and security. Some out of these 10 tobacco control measures, some of them will take effect immediately. For example, for non-duty paid cigarettes, if you violate the relevant rules, on summary conviction, the penalty will be as high as $1 million of fine and 2 years of imprisonment. On indictment, the penalty could reach $2 million and 7 years of imprisonment. According to statistics, over the past 3 years, the CNED every year seized 600 million sticks of cigarettes involving 3,000 people. If illicit cigarette activities remain rampant, this will compromise our tobacco control efforts, and this will also cause losses to the government tax revenue. Unscrupulous elements may also keep selling illicit cigarettes in public housing estates, and this will also give rise to money laundering problems. The government should give tougher penalties to ensure social order and to curb criminal activities. Lastly, on the harms of smoking, the government may stress the advantages of quitting smoking. On cigarette packagings, there are pictures that threaten people not to smoke. While it is so threatening, people still smoke. So can we adjust our strategies? As mentioned by the WHO, if you quit smoking for 2 to 12 weeks, this will help improve your blood circulation as well as lung functions. If you quit 1 year after you've quit smoking, you'll see your risks of contracting heart diseases reduced by half. If you quit smoking for 20 years, you will lower the risk of having lung diseases by half. All this can help us lengthen our life expectancy and improve our living quality. Thank you.
Ms. Carmen Can. Thank you, Mr. Deputy. I speak in support of the Tobacco Control Legislation Amendment Bill 2025, the bill for short. Smoking kills. It also adds to the pressure of our healthcare sector. A survey of the Hong Kong U was cited. It says that we have suffered a loss about $8.2 billion because of smoking. In June last year, the Health Bureau has announced a series of measures on tobacco control. The bill seeks to implement 8 of the 10 tobacco control measures. That includes introduction of a stamp duty regime for tobacco, increasing penalties, prohibition of possession of certain products, ban smoking when queuing, and expand no smoking areas. I was a member of the Bills Committee. I'd like to say that the bill has struck a balance. The HHB has conducted consultation and continued discussion for about a year with stakeholders. They have taken on board certain comments and incorporated them into the bill. Well, among the different factors, social cost, economic activities, health cost, I think that the administration has struck a balance. Banning smoking and economic activities are not on the opposing ends on different sides. It will be about the second quarter of 2023. By 2 phases, the ban on flavored cigarettes will be implemented. Menthol cigarettes is not banned yet in the first stage. The different controls will be implemented by phases. The first phase will be implemented in the fourth quarter of 2026. That means it's 4 years after the original restrictions on no smoking areas. And the focus is on possession of ASPs. I think the phased approach shows that the government has taken into account various factors as well as the impact on the business sector. It is important to combat illicit cigarettes. The government said that in the first stage they will combat against illicit cigarettes. In addition to the duty stamp regime for tobacco, I think enhancing enforcement is important. On the 5th of August, it's reported that there was a visitor coming to Hong Kong in possession of duty not paid cigarettes. He was stopped, searched. Later, he was convicted and fined. The Customs and Excise Department has taken swift enforcement action. Legal proceedings were completed swiftly as well. Inspectors of the Tobacco and Alcohol Control Office will be given additional powers. Last month, the office has already equipped frontline officers with body cams. I hope that inspectors of the office will dutifully carry out their duties. In a new stage of tobacco control, one of the aims is to stop youngsters from smoking. Youngsters may use ASPs to take drugs. In recent years, e-cigarettes has been packaged as something trendy. In May this year, the ICAC has cracked down on a syndicate. It's tested that the nicotine content of some ASPs is quite high. One capsule equals to about 40 cigarettes 40 packets of cigarettes. What's worrying is that the combination of drugs with ASP. Starting from 2023, we have seen new substances such as etomidate invading being rampantly used in Hong Kong. Well, over 128 people who use the drugs are under the age of 21. The situation is more serious. A lot of people add drugs to e-cigarettes. It's very easy to use e-cigarettes, and it's quite covert. In July, as reported, a 16-year-old had died being suspected of taking different drugs. E-cigarette has been found on his person. I do think that tobacco control enforcement go hand in hand. The ban will combat the use of ASPs to take drugs. In the deliberation, a number of members, myself included, said that there should be a ban on prohibition of ASPs to people under the age of 18. I'm glad to learn that the government has taken on board our comments by bringing forward the commencement date on the ban on providing ASPs to minors. I would now like to elaborate on my understanding as well as considerations on the ban. Well, there is additives added to flavored cigarettes. The traditional approach is to use it to mask the harshness of tobacco. A survey of the Hong Kong U has been cited that flavored cigarettes makes it easy for youngsters to get addicted. 40% of youngsters who smoke flavored cigarettes are quite seriously addicted. Pulmonary obstruction illnesses is also a serious illness. About 80 to 90% of the people suffering from this illness are smokers. Flavored cigarettes has a lighter taste. The government should ban it as soon as possible. Why is it that it will only be implemented in the second quarter of 2027? The government explained that they have carefully considered the situation because they would like to first focus on illicit cigarettes. They would like to wait till the full implementation of the tobacco control measures before they implement this ban. The government has struck another balance. In relation to substances covered by specified additives, I asked the question, what about substance naturally occurring in tobacco leaves? The administration explained that specified additives are substances added to another substance, and it doesn't cover naturally occurring ingredients in tobacco leaves and excludes substances necessary for the manufacturing of tobacco products. They think that there is no need to endorse Mr. Peter SHIU's amendments. The government should continuously assess the effectiveness of their measures. The control measures rely on the work of various policies and departments. They need to assess manpower and resource requirements. They need to work with other departments and other law enforcement agencies to step up their effort. They will also I would like to see that the government step up collaboration with the council against on smoking. Smoking is not just about that person. You should not subject other people to inhale second-hand smoke. Tobacco control is about the public health of Hong Kong. It's about our future. We have to remain unshaken in our work. Mr. Tan Yue Hang. Thank you, Mr. Deputy. I speak in support of the bill. Over the years, the administration has been stepping up the efforts on tobacco control. The general public have been cooperative. Smoking prevalence has dropped from 23.3% to about 9.1%. This shows that the work of the government has been effective. However, 580,000 people have continued to smoke conventional smoking products. This causes an economic loss of about $8 billion. To tackle the challenge, in June last year, a series of tobacco control measures has been announced. Well, we have to create incentives for people to quit. The bill provides a legal basis for a number of the measures. It is in line with public aspiration and social interests. The stamp regime provides the basis for law enforcement actions. The enhancement of regulation will make enforcement more effective. There is a ban on possession of ASPs, also a prohibition on a provision of CSPs and ASPs to people under the age of 18. This will address the problem of prevalence of the use of ASPs and smoking among youngsters. We need to, at source, reduce the availability of smoking products. There is sufficient buffer given to the public. There is an expansion on non-smoking areas, say for example, when queuing for public transport and entering certain places. The fine of smoking-related offenses will be increased from 1,500 to 3,000. These measures are conducive to protection of the public who are non-smokers. Well, I have some suggestions to make in relation to the way forward. The government needs to explain the new requirements better. Say, for example, the ban on queuing for public transport as well as when entering certain places. The government should enhance explanation. There should be examples cited. Signs that should be put up. At border control points and airports, there should be publicity stepped up targeting visitors so that visitors will not break our law unknowingly. There should be increase in resource allocation against illicit cigarettes. Training for frontline officers should be stepped up as well. This will be conducive to increasing the effectiveness of enforcement actions. There should be enhanced public education and publicity on smoke cessation services. Potential quitters may need support and counseling. There can be collaboration with the private sector to expand the support service network. There should be regular assessment of service provision, effectiveness, relapse rate. All the information is conducive to assessing the effectiveness of the measures. There should be a law to crack down on people who smoke and walk in the streets. In this regard, the public are disappointed. If you are walking behind a smoker, you'll be forced to inhale secondhand smoke. It happens all the time. It falls short of our expected protection of public health. So this problem should be properly addressed. Well, there is a ban on smoking when you queue, but if you're outside the designated area, it's fine. The way forward for the government is to address the problems of people who walk and smoke. There may be enforcement difficulties, but an effort should be made. Another point is in relation to designated non-smoking areas. The extension of no-smoking areas is good. However, at the same time, there should be designation of smoking areas. If you just ban without giving smokers a way out, there will be more problems. In Singapore and Japan, there are designation of smoking areas in the cities. They serve as good examples. There may be smoking areas and smoking rooms, and this will reduce the impact on non-smokers. And the restrictions will encourage more people to quit. The bill shows the determination of the administration on tobacco control. I hope that through multi-pronged tobacco control measures, addition of measures, the smoking prevalence will drop, so that people will be healthier, life expectancy will be longer. I speak in support of the bill.
Mr. Ka-fai. I think this is very familiar to everyone. I represent the education sector. I'm also a member of the Hong Kong Council on Smoking and Health. I support this bill for the sake of protecting the general public as well as young people. The administration announced in June 2024 the 10 tobacco control measures, including prohibiting the possession of smoking products by young people, including alternative smoking products, ASP, as well as conventional smoking products which are flavored. They will be banned as well, CSPs, in other words. I'm concerned about the flavored cigarettes or cigarettes with flavorings. This will cause a misconception among young people that if the cigarette comes with a fruit flavor or some kind of aroma, it will be less harmful. So this amendment bill seeks to disincentivize young people from becoming smokers. Now, there are a number of concerns. First, about recruiting young people to engage in illicit cigarette peddling. Now, this is a very serious problem. We have much tighter tobacco control measures nowadays comparing to before. But what I'm concerned is about the prevalence of illicit cigarettes. It's not just about distributing dim sum sheets for the ordering of illicit cigarettes in housing estates. There are advertisements on social media platforms such as Instagram claiming that they need young people to join in. Well, the ad doesn't spell out what job openings are available. It only says that the candidates will be paid well. Now, I discussed with some legitimate tobacco and alcohol sellers. According to them, these advertisements involve the sale of flavored cigarettes, illicit cigarettes, or even the space oil drug. And it also eats into the interests of legitimate sellers. So there are two problems. In terms of tobacco control measure targeting the real world, we need to consider the illegal employment of young people to engage in illicit cigarette peddling. We need to tackle the problem. The second point is that the existing tobacco control measures do not target the problem I mentioned. Now, the government or the law enforcement agencies may request the social media platform to remove the advertisements. But if you check the IP, you'll find that these advertisements are not posted in Hong Kong. So there is an enforcement issue. And there is no way to trace the mastermind. So on law enforcement, I'd like to make 3 points. First, well, there is a very good tobacco control measure involving the introduction of a stamp duty regime. But there are problems. There may be people collecting cigarette packets with the duty-paid labels. In fact, on the internet, you'll find people touting these packets and that you can put illicit cigarettes or duty-not-paid cigarettes in and resell them. So there is a law enforcement problem here. The second question relates to the designation of non-smoking areas within 3 meters of the exits and entrances of specified places such as childcare centers, schools, healthcare institutions, etc. Now, this could be a bone of contention, and this could lead to a legal battle. Smokers may say that they are not aware of the signage, and they are not aware of the existence of the non-smoking area. This is a major problem. Now, schools may have a proper entrance, but not so much for other care homes, healthcare centers, or clinics. So in the event of disputes, staff of the premises will have to deal with the problem. So this will become a potential issue. The third point is that according to the statistics in February, the number of primary students who are smokers, who use ASPs, on the rise. Well, that is peculiar. Nowadays, smoking gives a very different perception to that 30, 40 years ago. We no longer considered smokers cool. One reason why the number of primary students who are smokers is on the rise could be smokers at home, because children may get exposure of smoking from the family members. And it's very difficult to take law enforcement action if somebody vapes at home. The second point is about the sale of these products to primary students. Again, we need a more targeted approach to tackle it. My last point is this. I urge the Health Bureau to issue clear guidelines to schools with the passage of the bill. They should explain to the school principals across the territory how these cases should be handled. Say if the case involves serious assault, of course the school principals will call the police. But if students are found to be smoking or using e-cigarettes in school campuses, which is the most frequent scenario nowadays, what should the what should the schools do? They are not likely to call the police. But in fact, at the earlier stage, when these cigarettes are sold to students, it's already a criminal offense. The law enforcement agency should intercept at an early stage. It's a dilemma for schools whether to call the police or not if this student is found to be smoking there. So we need to strike a balance. We need the help of all the parties, like the health Department of Health, the Health Bureau, and other law enforcement agencies, as well as the education sector, so as to come up with the optimal solution, so that schools won't be caught in a catch-22 whether to call the police or not. I hope with the passage of the bill, the Office of Tobacco and Alcohol Control of the Health Bureau will provide guidelines and communicate with the education sector so as to prevent cigarettes or tobacco products of different nature to harm our young people. Mr. Ronald Chen. Smoking is hazardous. President, this is a familiar expression. Specifically, smokers will suffer from various diseases, and this will add to the burden of public health care system. But it's their choice. We need to respect their choice. But in the process of smoking, fumes are generated. This is the cause of secondhand smoking harm. According to studies, prolonged exposure of secondhand smoke could be even more harmful than the cigarette fumes themselves. And that is why around the world there are tobacco control measures to protect the general public. Now, we also have the tobacco control measures in Hong Kong, such as introducing a stamp duty regime for cigarettes, packaging requirements, designating non-smoking areas, etc. These are widely adopted measures in the global community, and data have shown that these measures are effective in controlling tobacco use and smoke prevalence. So, in light of our local situation, we should draw up tobacco control measures having regard to international practices. For example, in Singapore, with the strictest tobacco control measures in Southeast Asia, smoking prevalence dropped to 8.8% in 2023, which is a new low. One measure is to take a progressive approach in raising the age limit of smokers to 21. Now, this is a very good measure because young people have yet to be instilled with correct values, and they may be enticed to start smoking. So by starting young, we can take away the incentive and take the temptation away from young people and tackle the problem at source. Designating non-smoking areas is the approach taken by Russia. But a very strict approach is adopted. One breaches the law even by smoking at the balcony of your home. So we need to strike a balance. Smoking is, after all, not a sin. For senior smokers, it's very hard to kick the habit. And as consumers, they have the right to buy and consume cigarettes as well. As your residential premises are part of your privacy, so a citizen's right to smoke at home should be respected. Still, I think the Secretary can expand the non-smoking area, for example, to West Kowloon Cultural District or the whole of Tsim Sha Tsui. Then we need to be concerned about this, because if the area is vast, there may be people of different ethnicities and cultural backgrounds, and they may have different levels of acceptance of smoking. In fact, for the express rail stations in our country and airports, there are designated smoking areas. So whilst expanding the non-smoking areas, the government should also set up smoking lounges or designated smoking areas of a certain scale so as to address the demand of smokers. The other measure proposed in the bill is to raise the financial raise the level of fine from $1,500 to $3,000. However, this will only be a deterrence if law enforcement is effective. Now, during the deliberations of the Bills Committee, members already expressed concerns about the manpower and supporting the Tobacco and Alcohol Control Office. In Shenzhen, in 2019, sensors were installed in public places to detect cigarette smoke, and that smokers who are in breach of the law will be caught. The data will be sent to the back office. This can make up for the shortage of manpower. In Hong Kong, we have busy districts strewn with smokers such as Causeway Bay and Mong Kok. The government should make reference to the Shenzhen experience and deploy technology to step up enforcement efforts. Apart from conventional smoking products, there are also novel products such as chewing tobacco products, ASPs, that puts tobacco with a sugar coating, and young people may not be as vigilant. They may not understand the harm brought by tobacco. The government should also be concerned about the latest tobacco products and update the bill from time to time. And parent education is also important. They can help oversee the children to make sure that they stay away from the harm of tobacco. Hong Kong is an international city. We have visitors from different regions and countries, and many of them are smokers. We should explain to them our latest tobacco control measures in detail to avoid having them inadvertently caught by the law. We have land BCPs, express rail link stations, hotels, etc. These are places frequented by visitors. Posters should be put up at these places. There should be reminders issued for visitors to fully understand our latest requirements. This could help them comply with our laws. The objective is not to eliminate tobacco altogether. Through policy formulation, we help safeguard public health whilst allowing smokers a choice. Tobacco control strikes a balance between scientific evidence as well as a moral choice. The government has changed from a passive response to diseases to proactively building a framework to safeguard public health. I support the bill. The amendment bill involves some technical amendments to the rights and obligations. I support them as well. As for the members' amendments to be proposed, I believe that negative vetting should be maintained. If there are different views in the council, we can then consider the divergent views. As for the specified additives, this is a bone of contention. The government already explained the position. I'm not going to support the amendments.
Mr. Rock Chen, Deputy President. The Tobacco Control Legislation Amendment Bill 2025 seeks to protect the health of our people. We want to minimize the hazardous impacts of smoking on people. The government is adjusting its policy. It is banning the sales of conventional smoking products as well as e-cigarettes to minors. This shows that the government would like to protect our youngsters. This will reduce the smoking rate in the long run as well as reduce the expenditure on public health care. So I support the bill. Tobacco control is the right step to take for us. However, Hong Kong is an international metropolis. We are trying very hard to revive our economy and reinforce our status as an international city and tourism destination. We should not confuse visitors. We should not allow visitors to be caught by the law unwittingly. Some of the provisions are rather complicated. For example, childcare center, hospitals, as well as dental clinics and schools within 3-meter radius, no smoking will be allowed. However, without clear signages, citizens as well as visitors may get confused of where no smoking areas are. Also, we have to see whether there are ventilation railings as well as shelters for no smoking areas. We locals may not be able to understand completely the definition, not to mention visitors. Countries like Japan and the UK, they regulate smoking instead of imposing a complete ban. If we impose rules that are too stringent, international talents as well as overseas corporations may not choose to come to Hong Kong. This will harm our image. This bill bans the sales of hand-rolled cigarettes and other types of smoking products, and people may return to conventional smoking products instead. After increasing tobacco duty, we have seen a surge in cases of illicit cigarettes. For example, last year we had about 20,000 cases, up 80% compared to the previous year. We have about $8 billion of revenue from tobacco duty, but after increasing tobacco duty, the revenue dropped to $3.8 billion. This shows that stringent tobacco control yields limited effects, and this may give rise to illegal market activities, and this runs counter to our tobacco control targets. In order for the bill to achieve our legislative intent and goals and to protect people's health, but at the same time not to harm our international reputation, I have the following suggestions. The government must strengthen publicity to explain the complex provisions. We should use easily understandable wording to allow people to understand the provisions. At the airport, border control points, as well as tourist attractions, there should be instructions or signs with multiple languages to explain to visitors about the rules. There should also be clear signages. For example, in 3-meter radius outside designated premises, there should be clear signages to help people abide by the law. Also, after the passage of the bill, the government must step up law enforcement. We should have more manpower patrolling the no smoking areas and to combat illicit cigarette sales activities. There should be strengthened smoking cessation services to reduce the overall smoking rate. The bill mentions that the government will continue to monitor the tobacco control measures. I agree. When monitoring the situation, the government should consider the business environment, visitors' feedback, as well as international practices and experience to adjust the tobacco control measures accordingly. There should be report to the Legislative Council regularly. We should not impose rules that are too stringent in order to strike a proper balance. I so submit. Thank you. Mr. Chen Pui-Lun. Thank you, Deputy President. Tobacco control has to do with public health. It is to protect people's mental health. It is also a common policy. The smoking rate has been dropped to 9.1% in Hong Kong. To further reduce it to 7.8%, we have to work harder to achieve this goal. About 580,000 smokers smoke every day in Hong Kong. Some studies show that in 2021, smoke-induced illnesses cause $8.2 billion of economic loss in Hong Kong every year, and it adds to the great burden to our healthcare system. The government rolled out 10 tobacco control strategies. 8 of them require a legislative amendment exercise. I, as a member of the Bills Committee, I support the government in taking an incremental approach to implement these strategies in phases. One of the main points of the bill is to ban flavored cigarettes, to ban tobacco traders from adding menthol-flavored or fruit-flavored agents into conventional smoking products, which may cover the harshness of smoke, and because these flavors may induce female smokers to smoke or try their first puff. This is like a sugar coating. About 50 countries and regions around the world have banned the sales of flavored cigarettes, so Hong Kong is jumping on the bandwagon. Phased implementation is a balance struck among different parties. I think we are taking the right direction. Some are worried that the stringent rules may deter visitors from coming to Hong Kong and affect the economic development in Hong Kong. I don't agree. Health and economy, they are not mutually exclusive. They can coexist. Starting from this July, France, in all outdoor premises accessible by children, see a ban on smoking. The right for children to smoke fresh air overrides smoking right. In Singapore, in Thailand, there is a complete ban on smoking in some places. Hong Kong has never used smoking rights as a selling point to lure visitors. In the mainland, a lot of people are envious about the no-smoking environment in Hong Kong. I believe if we can get it right in our tobacco control strategies, we'll be able to ensure public health, and in the long run, we might be able to actually attract more visitors and ensure economic growth. It is crucial whether we can effectively combat illicit cigarettes. I'm very concerned about this. Costs are low for these illicit cigarette markets, and sales can bring lucrative profits. In recent years, syndicates that are caught, they face very little penalty, even if they are arrested. So there are still people who take the chances to sell illicit cigarettes. At different panel meetings of Let's Go, I called for tougher penalties, including greater fines and longer imprisonment terms. For selling non-duty paid cigarettes, the penalty would be increased to $2 million of fine and 7 years of imprisonment. I think it will create a deterrent effect. Some people, in order to save money, they may buy illicit cigarettes. So I welcome the duty stamp system for cigarettes to help people identify duty-paid cigarettes and duty-not-paid ones. I hope the government will review the system regularly. Some local tobacco traders sell cigarettes that are packaged overseas. I hope there will be enough communication with them to ensure that they can comply with the requirements. I think there should be strengthened publicity as well so that people know how to identify duty-paid cigarettes. They should know that buying duty-not-paid cigarettes is an offense. It is expected that by the 1st of January next year, no smoking areas will be extended to schools, residential care homes for the elderly, as well as other places. So there will be no smoking within 3-meter area outside these premises. I asked how we can tell from our naked eyes whether these smoking areas are within 3-meter areas or 3-meter distance. The administration said that smokers just have to keep a distance from these premises for about 8 to 10 steps. 10 of the public transport facilities will be set as no smoking areas. There have been signages and banners, and there are line or road markings. However, still, some citizens find these signages unclear, and it is hard for them to tell whether these places are no smoking areas. I hope the government can put clear delineation to these 3-meter areas and step up publicity. after no smoking areas are extended, the government should step up its law enforcement efforts as well as patrolling efforts to yield results. In 2025-26, we only had about 130 officers working under TACO. For frontline officers, there were only 125. For fixed penalty tickets, last year about 13,000 were issued. We believe that after the passage of the bill, the workload for TACO officers will become heavier. I hope the administration will introduce technologies as well as make flexible manpower deployment. We want to become a smoke-free city, and we have already made a big step here. I support the Tobacco Control Legislation Amendment Bill 2025. I so submit.
Mr. Kissen Yang. Thank you, Mr. Deputy. I speak in support of the bill. Smoking is harmful. According to a survey in 2023, 39% of smokers in Hong Kong started from flavored cigarettes. Among female smokers, the percentage is 60%. These cigarettes with added flavors are sugar-coated poison. The target is on women. For other products, say for example e-cigarettes, they are packaged as products that is less harmful. That's misleading. We see a lot of people taking idomidate in the streets. People drool, they shake, they wander in the streets, and they are delirious. I've seen some clips of these people with inappropriate behavior. I feel sorry for their parents. It shows that users of ASPs become more hidden. I have 2 children. I support the government's efforts in tobacco control. That includes the ban on provision of CSPs and ASPs on underage people, the adjustments of packaging of CSPs. These measures tackle the increase of smokers at source. I think it is good to extend the no smoking areas to schools and hospitals. I think what's more important is to teach youngsters not to start smoking. They need to educate youngsters about the harms brought by cigarettes. On platforms frequented by youngsters, say Instagram, Xiaohongshu, there should be enhanced publicity. Parents, when they find that the children are taking drugs or smoking, they don't know what to do. There should be enhanced parent education because they help in stopping their children from taking up bad habits. At the same time, we have to consider the resilience of the sector. There should be reasonable transitional period as well as support to practitioners. Smokers may buy substance to add flavor to non-flavored cigarettes. This is something that the government needs to tackle as well. Well, in Japan, Korea, mainland, there are a lot of smokers. They may come to Hong Kong, but you need to cater for this group. There can be designated smoking areas in tourist attractions so that visitors who are smokers can make use of the designated area. We also need to educate visitors. My ward office has received requests for assistance. Visitors have brought an excessive amount of cigarettes into Hong Kong. They've been detained and fined. Now, the requirements are more stringent. You can't even smoke when you queue. More explanation should be given to visitors. Clear signage in multiple languages should be put up at border control points and airports. There should be clear signage of designated areas. On different platforms, tourist guides, hotel websites, there should be messages disseminated. At the initial stage, there should be a tolerant approach to breaches by visitors. Advice should be given to them. More explanations and messages in different languages should be given to them. We don't want to dampen the image of Hong Kong as a result of these control measures. Tobacco control measures may have an impact on our tourism, but we can, at the same time, improve our service quality. This will offset the negative impact. In Singapore, Tokyo, there are vigorous tobacco control measures, but they are still popular tourist destinations. This shows that if you handle it well, tobacco control and tourism can go together. There is also the problem of illicit cigarettes. The market is rampant. Last year, the CNE department has cracked down on over 21,000 cases, an increase by 80%. They've seized about 614 million cigarettes. With the bans, there will be fewer options, and the price of cigarettes will increase. I asked the administration to increase resources to CNE departments and enforcement agencies. There should be enhanced collaboration with international counterparts to stop illicit cigarettes from coming to Hong Kong. The bill is an important step towards a smoke-free city. But we need to also work on education, publicity, and enforcement to reduce the number of speakers here. At the same time, we have to take into consideration education on visitors as well as the operation of the business sector. I so speak. Dr. David Lam. I speak in support of the Tobacco Control Legislation Amendment Bill 2025, the bill for short. I speak from the perspective of the healthcare sector. There is no good that comes from smoking. 1 out of 2 smokers will die of smoking-related diseases. Alcohol and smoking are harmful to your health. But alcohol has a very long history regardless of culture. Well, you need to be able to drink to be a cultured person. But that's different for smokers. If you smoke, the only party that profits are tobacco companies. But everyone, smokers, non-smokers, the entire society, pay the cost. People say that, if the healthcare sector is so hostile towards tobacco, then why not advocate for a complete ban? That is not the case. We don't hate or are not hostile. There's a possibility that we will advocate the ban on sale of tobacco products to people born after a certain date, but that is not under the scope of the bill. We have the duty to protect our future generations. At this stage, we aim to put in place a legislation to reduce the allure of tobacco products to youngsters and to protect people from the harm of smoking. Well, there are flavored cigarettes, conventional smoking products, and water pipes. They use flavored cigarettes to mask the harm of the substance. This will increase the chance of addiction, the risk of addiction. One of the aims of the bill is on flavored cigarettes. However, I regret to say that menthol cigarette is not banned at this stage. There are rumors saying that once the bill is passed, you won't see any cigarettes for sale in Hong Kong. That's my wish, but that is not the case. Tobacco companies are not allowed to add flavorings, but if it's a substance that is naturally occurring, then it is not banned. Well, as long as the substance is not added to another substance, then it's not banned. But if there is a suspicion that there is the addition of banned substance, the authority will have to prove that the substance is not naturally occurring, is artificially added. The burden of proof is on the prosecution. So there is no ban on naturally occurring substance on the banned list. In addition, the prosecution has the burden of proof that works for tobacco companies. The same design is adopted by Canada for many years. So the bill will not cause tobacco products to disappear completely in Hong Kong. I'm also concerned about protection of non-smokers. Under the bill, there is a ban of smoking 3 meters away from specified places. But outside the window or the rail is fine. There may be children, pregnant women outside clinics. So there are views that there is inadequate protection of the vulnerable. We realize that the way for tobacco control is difficult, but we have to do something. I speak in support of the bill.
Mr. Michael Tien. President, I was once a smoker. When I studied abroad, I watched a movie. The protagonist was holding a cigarette in his hand. He was so cool, and I just picked up the habit. And I smoked for 20 years. Now I've kicked the habit. I had determination exactly because the third daughter, who had been a victim of my secondhand smoke, one day told me, "Daddy, you should stay away because you stink." Her words became my incentive to quit smoking. I had no health concerns. I thought, well, if something happened to me, then I would be the one to bear it. It has nothing to do with anyone else. I didn't think about my daughter. I didn't think about my wife or anyone else. Eventually, I quit smoking. But I still remember very clearly this process. Years ago, I was in Taiwan. I stayed in a hotel. In the lift, a slogan says, "If you must smoke, don't exhale." So that means you're not just the only one who suffer from the smoking hazards, but others as well. Now, the bill proposes a number of measures, expanding the non-smoking areas, implementing a stamp duty regime, etc. I support most of these tobacco control measures, but I have reservations about prohibiting the sale of flavored cigarettes. It's not that I am opposed to banning the sale of such products. I'm just concerned that if you introduce a ban at that juncture as proposed, you might not achieve what you set out to do. This will be banned in the second quarter of 2027. Well, the ban will be introduced in phases. However, the bill is silent on the long-term objective of this measure. I am against taking a phased approach. I think flavored cigarettes should be banned together with menthol cigarettes in one go. The goal is, of course, to drive down the smoking prevalence of 9.1% in 2023 to 7.8% this year. I haven't verified that with the government officials, but I'm sure that the prevalence rate will go way beyond 7.8%. For flavored cigarettes, most of them are menthol cigarettes. Many female smokers, in particular, started with menthol cigarettes, and that becomes their lifelong habit. So why should the government ban non-menthol cigarettes first before banning menthol cigarettes at a later phase? I don't understand the logic. Most smokers smoke menthol cigarettes, but you start with banning flavors that are not favored by most smokers. I don't understand the logic. The ban should be introduced in one go, because otherwise those who are currently not smoking menthol cigarettes may switch to menthol cigarettes. And in the end, for the tobacco companies will benefit. The smoking prevalence will increase to a double-digit figure. At the panel meeting, I reiterated the same point to the Hong Kong KOSH as well as the government. Now, the government's intention, as explained, is that they wanted to introduce the ban in one go, but they received divergent views. Even if there are polarized views, the government should go ahead with the original intention. According to the government's explanation, they've chosen to take the middle-of-the-road approach, and they would start by banning flavored cigarettes before banning menthol cigarettes. Meanwhile, other measures will be introduced, such as the certificate of compliance system and ensuring that the cigarettes imported will not come with flavorings. I find it hard to palate. If you start with non-menthol cigarettes, smokers will turn to smoke menthol cigarettes, and there will be more smokers, especially smokers of menthol cigarettes, and by then there will be more opposing views. There will be no way to forge consensus by then, and the matter will just drag on forever. I understand the administration's explanation. They want to make a start first. It will take time to ban both non-menthol and menthol cigarettes anyway. So the government should start with banning products that are favored by more smokers first. They should not start with the other kind and call it a success. I'm perplexed about the government's plan in the long term. The government will be heading in the right direction. But I'm sorry to say this, Secretary, despite your competence, I really find it perplexing to start with this approach. I support the overall tobacco control approach strategy adopted by the government. I'm going to vote in support of the bill. But at the committee stage, as I understand, the Secretary will explain to us that despite all good intentions, in order to make sure the bill will be implemented smoothly, you have some distortions to the bill, and that is why I'm going to claim a division at the committee stage, and I'm going to abstain from voting. I would do the same for the third reading of the bill. So for the general public listening in, I want them to understand my point. Why is it that I am abstaining from voting on the Tobacco Control Legislation Amendment Bill? Because despite the correct way, I don't think the measures are effective enough. I give my broad support to tobacco control measures, but I need to explain why I will be abstaining from voting and I will be supporting something else, etc. It may look quite confusing. During the second reading stage, I'm going to vote yes to show my support for the overall direction. But then when it comes to the nitty-gritty during the committee stage, I will abstain from voting because I don't support them. So this is something I want to explain to the general public. I so submit. Mr. Perry, you. Thank you, President. Medical research has built ample evidence on the smoking hazards and the direct correlations with numerous diseases. Smoking harms not only the smokers themselves, smoking also harms other people through passive smoking, secondhand smoking. So the government's position is to safeguard public health and lessen the burden on public healthcare system. That is why tobacco control measures should be put in place to reduce the exposure of young people to tobacco products. This is only the responsibility of the government. According to the public consultation in 2023, 90% of respondents supported further lowering the smoking prevalence. So this is the mainstream view in our society. Undoubtedly, the tobacco control measures in Hong Kong have achieved significant results. In the 1980s, the smoking prevalence recorded was 23%. By 2023, it's dropped to 9.1%. Hong Kong has almost the lowest smoking prevalence around the world. According to WHO's 2022 data, the global smoking prevalence remained at 23%. In many places, smoking is prevalent. The tourism sector and the community are concerned that too stringent tobacco if the tobacco control measures are too stringent, it will disincentivize visitors from coming to Hong Kong. After the bill was floated, I had a meeting with the tourism and the hotel sectors. I also had an in-depth exchange with the Health Bureau so that our voices and our concerns can be heard, and that more measures can be adopted to accommodate our sector and allay the concerns of tourists. Now, first and foremost, we need to explain to visitors that we have tobacco control measures in Hong Kong, but we're not introducing a blanket ban on tobacco. According to the latest tobacco control measures, the government attaches importance to public education, as well as designating non-smoking areas and raising penalties in order to lower smoking prevalence, etc. For short-term stay visitors, they may not fully understand the publicity campaigns. They may not fully grasp the government policies. The sector is concerned about the misconception among tourists that if you smoke, you could be breaching the law in Hong Kong, and this may drive them away. And this may also disincentivize tourists who are smokers from coming to Hong Kong. So our sector would like the government to produce tailor-made publicity materials for visitors. There should be effective communication channels at tourist attractions and BCPs. There should be multiple language versions of publicity materials so that tourists can have access to correct information about whether they can smoke and where they can smoke in Hong Kong, as well as how many cigarettes they can bring into the territory in order to allay concerns. My second point is to clarify implementation details. I understand that the Bills Committee members discussed the possession of ASPs by transit passengers. According to the law, if you're a transit passenger coming in through the Hong Kong International Airport from other places without going through immigration clearance. You're allowed to bring the smoking device. And if you remain on board a flight or a vessel, then such items can be exempted as well. But meanwhile, the Hong Kong International Airport is promoting multimodal transport, and there may be different scenarios of transit arrangements, such as the Sky Pier at the airport. It's questionable whether the same exemption applies. The same goes for cross-boundary lorry drivers without going through immigration checks. The sector is also concerned about the ban on smoking whilst queuing for public transport. For example, no one should smoke while queuing for public transport at the bus stops and minibus stands, etc. What about coaches that hotels arrange for tourists? Can tourists smoke while queuing for the coaches? I hope the government will draw up clear guidelines. Through effective public education, our society has a different perception to smoking. And we are now pro-tobacco control. The government should start taking the lead. The government should step up public education and take a people-oriented approach. The government should also strive to explain clearly the policies to tourists so as to avoid misunderstanding and misconception. I hope the government will meet with the tourism sector as quickly as possible to respond to our concerns. On implementation details, the government should work with the tourism sector so as to disseminate the correct message to tourists and that we can strike a better balance between tobacco control and economic development.
Dr. Teck Ji-yun, Deputy President. We are here to scrutinize the Tobacco Control Legislation Amendment Bill 2025. This is a big step forward in terms of our tobacco control efforts. I fully support it. I think that as we support the bill, we have to look into our long-term planning and strategies to make sure that the tobacco control measures are as effective and will benefit the society. I have 3 suggestions. First, in terms of our targets and supporting measures, we don't control tobacco in order to ban smoking altogether. We want to prevent young people from picking up the smoking habit. We have to admit that we cannot solely rely on tobacco control measures to address the issues. There are still 580,000 smokers in Hong Kong. How can we help them kick the habit? That's the key. Smoking is a habit that is addictive. It's not just a personal choice. Nicotine in tobacco will induce addiction. Even though smokers may be aware of the hazards of smoking, it's difficult for them to kick it. So I think that the government should dedicate more resources to help smokers get rid of the habit. We should expand the scope of our support. We should put in place a hotline and increase the number of treatment centers and offer psychological counseling services. Second, for grassroots residents, we should offer them affordable nicotine stickers and chewing gum. Third, we should work with employers to put in place a no smoking workplace practice. Smokers are aware of the hazards of smoking, but many of them said that even with this enhanced tobacco control measures, they are not going to quit smoking. And the supporting measures do not target their difficulties. We have a very bad working environment in Hong Kong, and as a result, employees are faced with significant stress. As a result, they may pick up smoking, and some of them are social smokers. Tobacco control measures should not just focus on prevention. We should let smokers see hope, and only when it happens can we see the light at the end of the tunnel. Second, on the definition and hazards of flavored cigarettes. The bill proposes to ban the sale of flavored cigarettes. Flavored cigarettes means cigarettes with additives added, which will mask the smell of smoking, and fruit flavorings may be added to conventional smoking products. Studies show that flavored cigarettes are very attractive to young people because the flavorings will mask the smell of the cigarettes and it's more addictive. Many young people smoke flavored cigarettes when they first pick up smoking, and this is how cigarettes manufacturers attract new smokers. I think that apart from that, we have to look into the heaters, and that's a type of chemicals added to the cigarettes in order to make it easier for smokers to smoke cigarettes. This kind of combustion accelerant will make the cigarettes more appealing, and it help with the combustion of cigarettes. Third, I have some suggestions on stamp duty and how it should be used. The revenue generated from the stamp duty is quite handsome, and I think that is probably not put to the best use. I think that the government should set up a dedicated fund on how we can make use of stamp duty generated from the sale of cigarettes. It should be spent on tobacco control education so that young people are aware of the hazards of smoking from a young age so that they don't pick up smoking. Second, on services that help smoker quit smoking. Third, we should also spend it on medical services. We should establish a fund to help people who suffer from smoking-related illnesses, say, for example, lung cancers and cardiopulmonary diseases. Apart from this, the government should regularly publish the usage of the fund to make it more transparent. President, smoking is a complicated public health issue. The effectiveness of the tobacco control measures lie on whether the number of first-time smokers will drop. This bill is an important step forward in terms of our efforts. More importantly, we need facilitation measures. I believe that through a comprehensive tobacco control measures and scientific approach in helping people kick the habit, and a more comprehensive system of how we use the stamp duty, we will be able to build a more healthy society for the next generation. I so submit. Thank you.
唔該，主持
Miss
今日嘅2025
Deputy President, I speak in support of the Tobacco Control Legislation Amendments Bill 2025. This is an important step of our new phase of tobacco control.
推進機會。
This is how we respond to the aspirations of the public. According to a study of Hong Kong U, it is found that in 2021 there were about 4,600 deaths related to smoking. We lost about $8.2 billion in terms of monetary loss. the smoking prevalence dropped from 9.5% to 9.1%, but there are still 580,000 daily smokers in Hong Kong. Tobacco control is how we narrow the inequity in society. The government rolled out 10 different measures to make smoking less luring. The government is going to step up publicity and education and strengthen smoking cessation services in order to control tobacco. I support the bill. The smoking prevalence in 2023 is about 9.1%. For Singapore, is 8.8%. I think that we can compare measures with that of Singapore. The bill will put in place a certification regime and will put in place many measures and phases. In 2016, Singapore already prohibited the importation and sale of flavored cigarettes. I think that we can learn from the Singapore's experience by stepping up the frequency of inspections so that there will not be any new types of cigarettes emerging in the market. In Hong Kong, we are going to ban smoking while queuing and smoking when people are at 3 meters distance from designated public places. So how can smokers tell where the no smoking areas are? I think that the government should put in place clear markings on the road and clear signage. I noticed that under I-Quick scheme of Singapore, they offer support to smokers. They offer a 28-day target for smokers to help them quit smoking. In Hong Kong, I see that we have been providing medical and online support for smokers to quit smoking, and we do have KPIs. According to Singapore's experience, we learned that we should adopt a people-oriented approach apart from enforcing laws to combat tobacco and lower the smoking prevalence. We all know that smoking is hazardous to people's health, and we need to lower the impact of smoking to others. We've been trying to lower the smoking prevalence, but at the same time, we need to show support. We need to, while enhancing and increasing the penalty level, expand the scope of smoking cessation services. We need to change the measures from prohibition to support. We should tell people that we are putting in place these measures to ensure a clean environment for elderly. For visitors, we sometimes see on social media platforms where they have to abandon their cigarettes as they enter Hong Kong. They didn't know that that visitors were only allowed to bring in 19 sticks of cigarettes when they enter here. So as a result, I think that the government should step up publicity and education, and we should remind them in advance. We can work with the travel agencies and airlines so that visitors will be notified of our measures as they receive their e-tickets, for example. I think that on the hotel websites, we should put in place also this reminder on the fact that flavored cigarettes are not allowed in Hong Kong. Also, at the lobbies of airports, we can put in place LED advertisements. We should also put up posters at MTR stations, at E-channel. At the first phase of implementation, I think that we should be more lenient. We can provide written warnings to those who violate the regulations. The bill adopts a progressive approach. We have had regards to the interest of manufacturers, smokers, and the general public. This is how we can lower the medical expenditure in relation to smoking. As long as we adopt a more compassionate approach and step up publicity, I think that we will be able to go for and become a smoke-free society. As a member of the Legislative Council, I have a responsibility to fight for a next generation.
Mr. Stephen Ho. Thank you, President. When it comes to tobacco control, we have been debating on this for many years. The 10 measures announced by the government, we support 9 of 10 of them. I emphasize that despite the diverse political spectrum here, no one would say that smoking is good. I surely hope that no one would smoke anymore in the world. I myself am not a smoker. So on that premises, we are working along the same directions with the government. I thank the Hong Kong SHIU government for its past effort. Much progress has been made. Over the past 3 decades, when I was a kid, I saw that there would be an ashtray on each table in the Chinese restaurants. People would give out packets of cigarettes on various occasions. So the smoking preference rate has dropped from 20% to 9.1%. So when there is a large smoking population, it is justifiable to adopt aggressive measures to reduce the smoking prevalence rate. But now, when the smoking population has decreased to a critical mass, then additional measures will not do much. Even with the increased stamp duty, tobacco stamp duty, the tax revenue has dropped. So I think we need to review our strategies. Should we just focus on controlling the smoking problem in Hong Kong? Of course, that's necessary. That's why I support the 10 measures. But if it is very convenient for smokers to get hold of cigarettes from outside Hong Kong, then the strategies will not be effective. So I will continue to talk to Professor Low on whether we can establish something like a GBA Tobacco Control Alliance together with our neighboring cities. If there are fewer smokers around you, then you would be less likely to smoke because of peer pressure. Now, if a lot of people in the mainland like smoking, then the environment would be less favorable for your measures. Now, I'm not saying I oppose to your measures. I even encourage more aggressive approach. For example, banning smoking in the areas of 10 meters outside entrance. And if you give a child a cigarette, you should be fined exponentially. But we must consider whether there would be other side effects. For example, like Mr. Perry, you mentioned, will this affect our tourism strategy? It will affect how tourists and the world sees us, especially those people who are not familiar with our law. I think many of those who are fined because they brought along more than 19 sticks of cigarettes into Hong Kong are foreigners, because they are not aware of our rules. Now, normally law-abiding jurists may be caught on the wrong side of the law. Now, Mr. Peter SHIU gave us a lot of figures. The black market for illicit cigarettes is vibrant. Now, we always see reports of hundreds of thousands of sticks of cigarettes being seized by the Customs and Excise Department. But if you take a closer look, you can see the market is still very vibrant. When there are tobacco control measures, those who jump out to support the government are those criminal syndicates. They will tell their clients, see, tobacco stamp duty is going up again. Why don't you just buy illicit cigarettes from us? So with this economic situation, I think it would be wise to consider the practicality of our measures. I don't think we can dent the trend of a thriving illicit cigarettes market with our measures. Now, I agree with most of the measures in the bill, however. On the other hand, when we passed an amendment bill to ban ASP and heated cigarettes, I asked the government to conduct a research on its impact on the economy. The government did not listen to me. Now, in this time of legislature, we need to amend the law to allow transshipment of heated tobacco products and ASPs in Hong Kong, because that affected the logistics trade. So I hope the government would conduct sufficient research in the future. I don't want to see that we have to amend the law again because of lack of research. Sometimes it would be too late. So we need advanced studies and sufficient research. Now, finally, in the legislative process, the government is still bogged down by pre-existing legislative framework. For example, prohibition to offer smoking device to a person under the age of 18. Now, for a conventional cigarette, it would be $3,000 in fine. If you give a minor a stick of ASP products, that is a vaping device, the fine would be $50,000. Why is there such a big difference? One is $3,000 and the other one is $50,000, and 6 months imprisonment. In my opinion, we should be harsh on both of them. There should be a universal fine of $50,000. However, I think it is better than no punishments, despite too lenient. So I hope in the next round of legislative exercise, we will not single out conventional smoking products. As long as the product is bad for the next generation, there should be a harsh fine. Now, since the framework is already there, maybe you find it too troublesome to overhaul it. Finally, a major concern is illicit cigarettes. There are many methods to crack down on illicit cigarettes. In my constituency, I see a lot of criminal syndicates not being caught. Those who are sent to prison are just foot soldiers. But you have never caught the masterminds. So I think we need to reduce the margin of profit for selling illicit cigarettes. We need to strike a balance. Otherwise, the results or effects would be undermined. I think we are paying too high a cost to achieve little effect, and those who are affected are those honest traders. So let's pay attention to the livelihood of this group of small businesses. Discouraging tobacco use has health benefits. However, there are historical factors and cultural issues at play. If you prohibit smoking completely, some people would lose their living. This saddens me. So if the economic situation is still doing well, we should help these families and businesses affected. Mr. Lai Tong-kwok. President, I speak in support of the Tobacco Control Legislation Amendment Bill 2025. The 10 tobacco control measures are harsh, but they highlight the government's determination and seriousness in combating tobacco use. Smoking cigarettes affects health, and it comes with a heavy financial cost. Now, research reveals that the 10 measures are helpful to make Hong Kong more healthy. But I must point out that even with a robust set of legislation, without enforcement, it would be a toothless tiger. After the passage of the bill, the government must ensure that there are sufficient law enforcement officers to enforce the law. According to the civil service structure, in 2025-6, the approved establishments for the Tobacco and Alcohol Control Office is 183. Among them, 125 are frontline officers. They account for only 70% of the establishment. If we evenly deploy the 125 frontline officers to 18 districts, that means there are only 6 to 7 frontline officers in each district. We have a 7.5 million population. There is only one frontline tobacco and alcohol control officer for every 600,000 population. It is too low. Then people may ask, do we have the manpower to enforce the 10 measures? Now let's look at the figures of law enforcement. In 2022, the TACO has issued 6,296 fixed penalty notices. Last year, the number increased to 13,488. The number has doubled over the span of 1 year. It seems to be a progress, but if you take a closer look, every frontline officer only issued one FPN on an average of 2 days. Illicit cigarettes are running rampant. That's a well-known fact. Despite the customs and excise stepped-up effort, smokers can still easily buy illicit cigarettes from various channels. Now, the government has banned e-cigarettes for many years. But just take a look on the streets. There are a lot of people still using e-cigarettes. President, I understand that the government would organize major joint departmental enforcement actions each year, but they only give rise to a short-term boost in arrest figures. There are still too few daily inspections. Surprise enforcement actions cannot achieve sustained deterrence. Tobacco control relies on long-term monitoring and sustained inspections. Surprise inspections and enforcement actions alone are not enough. The public supports tobacco control, but they are more concerned whether the government has the capacity to implement its policies. With the lack of enforcement power, the 10 measures will be in vain. The policies must have tooth. to achieve deterrence. I support the bill, but I make a solemn appeal to the government to address the issue of lack of manpower head-on. There should be more coordination between law enforcement agencies. We need to build a healthier and more livable smoke-free Hong Kong as well as
Ms. Connie Lam. Thank you, President. I speak in support of the Tobacco Control Legislation Amendment Bill 2025. The administration introduced 10 tobacco control measures. There are different views in the community and from legislators. Healthcare, education, social welfare organizations, 40-odd organizations support it. However, there are also views that tobacco control measures that are too strict will affect the freedom of people, and it might even stimulate the market of illicit cigarettes. Therefore, it is not difficult to understand that we must press ahead with tobacco control measures. The key is how to implement them. We need to strike a balance between safeguarding public health and respecting personal freedom. We also need to take a progressive approach when we implement tobacco control measures in order to minimize social controversies. 10 tobacco control measures in short, medium, and long term. This will help smokers to better adapt to these measures, including expanding NSAs, banning smoking while lining up, and banning the possession of ASPs. For flavor cigarettes, the bar industry is opposed to it. Some of these bars actually sell flavor cigarettes, and this ban will affect their business receipts. However, some bars are actually operating illegally in confined and cramped spaces. Shisha smoke and fill up the establishments. Apart from legal considerations, these bans will scare away smokers, and I believe the losses will only be limited in the short run. In the long run, the situation will not be the same. Earlier on, members of the public or the industry related to me, there are different flavors of flavor cigarettes. For hand-rolled cigarettes, they contained different flavors as well, say vanilla, whiskey, and so on. The relevant bans might affect the livelihood or the business of retailers and wholesalers. I hope that the Secretary will maintain liaison with the industry in order to help them with transformation. I'm a social welfare worker. Development of adolescents and teenagers is close to my heart. A lot of teenagers try smoking starting with e-cigarettes. Some of them have started smoking because they have started with e-cigarettes. We need to introduce measures against flavor cigarettes, and this will reduce the incentive for teenagers to get started with smoking. And I believe this bill will give members of the public who smoke a transitional period. But of course, the best practice is that we need to encourage smokers to quit smoking. So regarding Mr. Michael Lee's CSA, I cannot go along with his amendment because it runs counter to the purpose of the 10 tobacco control measures. In overseas jurisdictions, the minimum age for one to buy cigarettes is 21 years old. This will prevent teenagers from starting to smoke because they aren't mature yet. Childcare centers, hospitals, DOH, clinics, elderly homes, and so on. 3 meters from these establishments will be designated as NSAs. This is covered by the bill. It might be easy for smokers to follow the law easily. There might be arguments or controversies. I suggest that the administration step up publicity, explain more to the public, and we can also draw reference from Japan. Say we might designate certain smoking areas, and that is exactly what I say every day. And this will help us curb the situation of people smoking while walking in the streets. We don't want to give people the impression that when we set up smoking zone, it is equivalent to encouraging people to smoke, but I do think this won't happen. There are, of course, smokers in Hong Kong. We don't want to see people or smokers surrounding rubbish bins to smoke. So we might as well set up smoking zones so that we can better keep the situation in check. Tobacco control requires continuous efforts. We need to strike a balance among different factors, say the real situation of society, interest of different stakeholders, and so on. The 10 tobacco control measures show that the administration is willing to listen to different views in society. The administration should keep a close eye on the effectiveness of different measures, especially for the possible impact on SMEs when it comes to the business receipts of cigarettes, as well as smoking cessation services. At the same time, the government needs to enhance efforts in relation to cracking down on illicit cigarettes. Thank you. I so submit. Mr. Chun-keung. Thank you, President. I speak in support of the Tobacco Control Legislation Amendment Bill 2025. The bill is aimed at introducing 8 of the 10 tobacco control measures. We want to reduce the smoking prevalence rate. Hospitals, childcare centers, and so on, 3 meters away from these establishments, these areas will be designated as NSAs. This is aimed at protecting children, students, and patients. We also want to protect non-smokers from inhaling passive smoke. For theme parks, hospitals, there will be NSAs as well. The bill also covers the increase in the penalty for smoking illegally. This will enhance deterrence, and I believe we should recognize this direction as it helps us to move towards a tobacco-free Hong Kong. Some people report the existence of cheap whites, and there are worries in the community that there might be transactions of illicit cigarettes through dim sum sheets. This will affect tobacco duty, and this will also affect the effectiveness of tobacco control measures. The sale and purchase of illicit cigarettes is unlawful. We need to introduce the relevant regime, that is the duty stamp regime, for enforcement officers to better recognize duty not paid cigarettes or tobacco products. The penalties should be enhanced in order to curb the prevalence of illicit cigarettes. The administration should formulate a comprehensive plan in order to control the situation and to address the possible challenges in the future. Some smokers look forward to having smoking zones in Hong Kong. This might slightly keep in check passive smoke, but it might not be very effective. In designated smoking zones or smoking areas, a lot of smokers are clustered in these areas, and this will also cause impacts to non-smokers. We shouldn't send the message to teenagers that we encourage smoking. If this is passed down to future generations, it will be all the more difficult for us to achieve the vision of a tobacco-free Hong Kong. The bar industry, street stalls are worried that tobacco control measures will affect the local economy. We have received a total of 1,071 submissions. There are submissions for and against the bill. I hope that the administration will look into the situation, liaise with the trade bodies in order to better understand the actual difficulties facing them. We also need to take into account the reality so that we can strike a balance. Thank you.
Mr. Edward Leung, thank you, President. I speak in support of the bill. As a health and hygiene speaker of the DAB, I'm fully aware of the hazard of smoking. I recognize the efforts of the government to control tobacco, and I support it. But since the announcement of the bill, the community and the relevant trade told me that they have different views. One of the key words of the bill is control instead of ban. This shows that cigarettes is not dangerous drug, so we have to control it instead of ban it. How can we prevent young people from coming into contact or coming across cigarettes? The DAB has this view on the prohibition of offering cigarettes to people aged under 18, expanding no smoking areas, and implementing duty stamp regime. We support it. There are 2 members who are going to move amendments. This shows that there are still doubts against the bill in the community. In fact, in the past, the administration made false estimates because originally they were receiving $7 billion of revenue. Eventually, they collected only $4 billion. So that's a few $billion in terms of the difference. Is it because less people smoke, that's why the stamp duty collected is lower? That's not the case. That's because smokers switch to smoking cheap whites. The plans of the government perhaps cannot catch up with the reality. The bill proposes to ban flavored cigarettes. I think that this is a goal that is difficult to achieve, and many more people will switch to cheap whites. And cheap whites is already illegal, as will not be affected by the bill. Manufacturers may attempt to introduce flavors to those cheap whites, and this will bring about even more hazards to our smokers. Apart from this, we prohibit only the sale of flavored cigarettes instead of importation. So people can go to the mainland, they can purchase a package of cheap whites for $30 and they pay the stamp duty of $30. After paying $60, they can legally smoke flavored cigarettes in Hong Kong. For smokers in the new territories, it's very easy for them to purchase flavored cigarettes on the mainland. I think that the government should address this gray area. After banning flavored cigarettes, the government will not only collect less revenue, retailers will be affected as well. We see chain convenience stores, grocery stores, seeing that cigarettes actually account for 30% of their revenue. If we ban it, their business will be affected. Once we ban flavored cigarettes, smokers will not only switch to cheap whites or purchasing them on the mainland, the revenue and business of the retail stores will be deeply hampered. Do we want to see that? For bars, they very often offer shisha for customers to smoke at the outdoor areas. Shisha usually come with flavorings, so when we ban flavored cigarettes, this type of bars would be very much affected. At the Bills Committee meetings, we propose that if the shisha does not contain nicotine, the bars should be allowed to offer them. The administration undertook that such products can continue to be offered, and I hope that the administration will keep to their promise. There are two types of CSP. One comes with flavorings, one does not. It seems that we are banning all types of cigarettes across the board. We wrote to the administration on the 7 types of chemicals that are present in the cigarettes. They will be exempted under the bill. This will affect the manufacturing of conventional smoking products, and eventually this type of product will become extinct on the market. This definitely does not mean that smokers will quit smoking, because many of them will switch to cheap whites. It's true that the administration can step up enforcement, but as long as there is demand, there will be supply of cheap whites. The administration said many times that Canada adopts the same list and they see no problems. That's why we won't either. But they miss out something. Canada offers other types of options, say for example, weed, heated cigarettes. We don't allow any of those in Hong Kong, so we cannot compare ourselves directly to Canada. So the DAB is very much worried that the bill is too harsh, and the bill actually goes against the intent of the government. Mr. Ka-fai proposed group CSAs, Group 2A, and I think that the government should consider it. The amendments have regards to the interest of the manufacturers while allowing conventional smoking products to continue to exist. While we limit the sale of flavored cigarettes, we can protect the interest of a younger generation. The administration said that the problems that we raised will not happen. We believe that the government will not wrongly estimate the stamp duty revenue again. And I believe that the government will not change its mind like what they did before. Lastly, I'd like to talk about what we're disappointed with the bill, which is that we have not addressed the issue of people smoking while walking. The administration said that they will expand no smoking areas, but that's not about the issue that I mentioned. It's difficult for us to ban people to smoke while they walk. What constitutes drunk driving? Well, as long as a person's alcohol content in their body exceeds certain limit when they go from point A and point B, they will be considered being drunk as they drive. So I don't think that if we apply the same to people who smoke while walk, it would be as difficult. I agree that there will not be a perfect solution to any problem, but the bill actually undermines the interest of smokers. I believe that they all know that smoking is hazardous, but it's difficult for them to quit and they have no choice. If we want to prevent anyone from picking up smoking for the first time, then we should adopt harsher measures against such a cause. For long-time smokers, we should be more compassionate. We should help them cease the smoking habit, but we should not label smokers as dangerous drug abusers. I so submit. Ms. Lillian Kwok. Thank you, President. As a member of the Bills Committee, I speak in support of the Tobacco Control Legislation Amendment Bill 2025. We all know that smoking is hazardous to health. According to the World Health Organization, every year there are over 8 million people who die because of smoking-related diseases. Over $1.2 million pass away because of secondhand smoke. Smoking, well, I see chronic smokers whose lung functions have been so impacted that they could not walk, and eventually they have to be wheelchair bound and they have to wear medical equipment. In 1982, Hong Kong established the Smoking Public Health Ordinance to protect health and to put in place tobacco control measures. The ordinance have been enacted for 40 years. A prevalence went from 23.3% in 1982 to 9.1% in 2023. After that, under the non-communicable disease plan in Hong Kong, we tried to lower the smoking prevalence to 7.8% in a few years' time in order to lower the medical burden of Hong Kong. During the scrutiny of the bill, the Bills Committee meetings have been meeting different stakeholders to collect their views and listen to their voices, and they relate their views to the administration so that our tobacco control measures can be more comprehensive. I'm grateful for the administration for taking on board many views of the members in their CSAs. They empower the Secretary for Health to establish their certification regime and extended the transitional period for implementing plain packaging on the cigarettes packages. The administration said that they will prudently implement tobacco control measures so that there will not be any undue inconvenience caused to manufacturers and members of the public. I'm worried about the new queuing measure. It is said that when there are 2 or more than 2 people queuing for public transport, then no one should smoke. However, if originally there was only one person waiting for public transport and suddenly there was another one who come along, how should we initiate enforcement action when this happens? So I think that the administration should provide a clear guidelines on enforcement so that law enforcement agencies will not come into dispute with members of the public. Second, we're going to expand the no smoking areas to designated places such as, well, the 3 meters area of childcare centers, hospitals, and residential care homes. I think that the government should explain their measures more clearly to smokers and members of the public so that they know more about the new measures and so that they can adapt to the new requirements. To put it simply, by putting in place these measures, we try to lower the smoking prevalence and reduce the number of daily smokers in Hong Kong. In order for us to achieve these goals, we have to make smokers quit smoking, we have to lower the number of smokers, and we have to prevent anyone from picking up smoking for the first time. So I think that as a first step, we have to incentivize smokers to cease smoking, and second, we have to offer smoking cessation services. I think that we have to continue to improve our smoking cessation services. For example, we should offer appropriate support to smokers so that they will not give up halfway. There are 70 treatment centers under DH across the territory offering different types of services. As we all know, it takes a long time for people to quit smoking, it's very likely for people who have quit smoking to relapse. At different stages, we need different forms of intervention. So I think that the government should review the cessation service that we offer so that we can make our services more effective. Under the existing framework, I have the following suggestions. First, we should step up the role of family doctors in smoking cessation. They should be offered professional training so that they know more about the types of drugs that help people quit smoking, say, for example, alternative nicotine, chewing gum, and products, and they should be trained in counseling, and we also have to have a clinical mechanism to review the service that we offer. Second, we should enhance training for smoking cessation centers. We should train more professionals, say, for example, pharmacists, nurses, in taking part in smoking cessation services. We should offer behavioral assistance and medical assisted or drug assisted cessation. Third, we should step up case management. At district health centers, we should have trained counselors offering 3-month, 6-month, or 9-month follow-up action. We should also continue to monitor the progress of people who have quit smoking so that they will not relapse. Fourth, we should review the effectiveness of service centers. We can improve some of the services offered. We could include case management, drug treatment, so that we adopt a evidence-based smoking cessation approach. We hope that non-smokers will not come across cigarettes or pick up smoking. So the government should continue to step up publicity and education, say, for example, by offering parental activities to enhance people's awareness of the hazards of smoking so that they will not pick up smoking. There are many young people who smoke, and I think that we should step up education at schools. We should set different learning goals and approaches. We should start from kindergarten and primary schools. We should let our children know that smoking is not good for our health. At secondary school, we can talk about the chemical makeup of cigarettes so that the secondary school students know more about the negative impact of cigarettes on people's health. President, tobacco control measures can lower the smoking prevalence of our city, and it will reduce the likeliness of people suffering from smoking-related illnesses. So I would think that we should support them, but we have to strike a balance. I hope that the government will take a more compassionate approach. But for all sorts of addiction, like dangerous drug addiction, smoking addiction, it's also about their psychology. We can make use of counselors to help people get rid of their addiction. In the future, I hope that we can become a smoke-free city and a healthy city. I so submit. Thank you.
Mr. Scott-Leung. Thank you, President. The work of tobacco control cannot be achieved at one leap. We have to be gradual. We have to cause gradual behavioral change to avoid backlash. I support the bill. In the bill, there is a phasal approach. The tobacco control measures will be implemented in phases. To smoke or not to smoke is the individual's choice, but we should not affect others' rights by doing so. Now, the bill proposes to prohibit smoking while queuing and also enhancing the penalties for breaking the law. I support them. It will improve the environment without undermining the rights of smokers. Now, the bill proposes to ban the possession of ASP products like e-cigarettes and vaping devices. I support it. It will undermine unscrupulous advertisements which affect women and youngsters by claiming that ASP's harm is lower than that of conventional cigarettes. On the contrary, ASP substance is proven to be harmful. They contain heavy metals and carcinogenic substances which may cause chronic diseases. And more worryingly, ASP producers give a lot of flavors to the product, which attracts a lot of youngsters. Now, Hong Kong has banned the import, sales, and possession of ASP products for commercial purposes. However, there are some loopholes which allows some smokers to continue to use ASP products. This bill will fill that gap. Now, recently, vaping devices are being used for drug consumption. Some criminal makes etomidate into e-capsules and sell them to youngsters. Some young people mistakenly think that etomidate is not a dangerous drug. In the summer holiday just passed, 2 youngsters have passed away because of overdosing of etomidate. Now, this bill will enhance the power of the law enforcement agencies and help suppress the issue of etomidate. Now, the bill will also ban the flavoring of cigarettes by adding flavors of fruits and menthol. It will make cigarettes more attractive. According to a survey, more than 70% of the female smoking population use flavored products. The percentage for the younger generation is even higher. So I fully support banning flavored cigarette products. But I can see there's a kind of product being sold in various shopping malls. They cost just $20 to $100. By putting those little capsules or beads into the e-capsules, it will give flavor to the vape. So in the future, we should study how to crack down on these e-beads or e-capsules. Otherwise, the effect of this bill will be undermined. I also support the measure to require duty stamp on duty-paid cigarettes. From importers to manufacturers, they have to ensure that there is a duty-paid stamp on the cigarettes. The authenticity can be verified by the Customs and Device Department. I think this will be effective in cracking down on duty-not-paid cigarettes, including cheap whites. Of course, the new measures will bring about challenges to the trade. It will also cause short-term inconvenience to smokers. But I think the government has already struck a balance between the effect and the need for transitional measure. So the prohibition or the restriction will be extended gradually to other cigarettes, including menthol cigarettes. It will help minimize the backlash and also friction in certain societies. Now, on the other hand, many inbound tourists are not aware of our latest requirements in relation to smoking. Now, besides no smoking in indoor areas, some inbound tourists may bring along flavored cigarettes or heated tobacco products or ASP devices to Hong Kong. And they may be caught on the wrong side of the law. So we need to step up publicity as the airport, and also we should spread the message through travel agencies and our websites to urge tourists to inform tourists of our latest requirements. Tobacco control is a long-term work. Besides legislation, we also need publicity and education to tell the public how harmful smoking is. We should also provide more assistance and counseling to smokers. We need to provide incentives to smokers to quit smoke. We need a smoke-free environment so that our next generation can grow up in a healthy Hong Kong. There is already a consensus for that. Down the road, I hope society would discuss the matter of tobacco control in a sensible manner. We should focus on the topic and the benefits of tobacco control rather than politicizing the matter. Thank you. Mr. Adrian Ho. Thank you, President. I speak in support of the Tobacco Control Legislation Amendments Bill 2025. Professor Lo Chong-mao mentioned this year that the smoking prevalence rate is 9.1%. That translates into some 580,000 smokers. There is a worrying trend of youngsters using e-cigarettes and vapes. Now, etomidate, aka space oil, has been harming our young people recently. Heated tobacco products or vapes are quite easily obtainable. Now, the youngest user of etomidate, we know, is just 15 years old. The situation is worrying. That's why we support and understand where this bill comes from. The government is using a multi-pronged strategy to lower the smoking prevalence rate, and there are targeted measures. There is a right balance between the benefits of smokers and non-smokers. Now, there are some worries that the bill may affect the willingness of tourists to come to Hong Kong. But I think the impact would be insignificant. Now, take myself as an example. I'm not a user of conventional smoking products. When I choose my tourist destination, I will not consider whether the destination has a cigarette ban. So I don't think there is a direct link between the two. According to the WHO, the global smoking prevalence rate has been on the drop. As at 2022, the global prevalence rate has dropped to 20.9%. That is some 1/5 of the global population. They are in the minority. In Hong Kong, the 9.1% smoking population is quite low. Now, these figures have convinced me that the tobacco control measures would cause limited impact on our population and our tourists compared with our neighbors, and also popular tourist destination in Asia. Our tobacco control measures are quite lenient. Take Singapore, also an international metropolis, an example. I have visited the place quite a few times in recent years. I have visited tourist hotspots and Ka-fai areas by the river. There are very few smoking areas. The restrictions are even stricter than those we have. Since 2019, Singapore has designated all areas near the tourist hotspots no smoking areas. Those who breach the law will be fined some 6,000 Hong Kong dollars. That's quite steep. There are very few smoking areas. The areas are very small and there is no shelter. At peak hours, smokers need to queue up to use the smoking areas. Another popular tourist destination, Seoul in Korea. The situation is similar. There are more and more no-smoking areas. Indoor areas are essentially smoke-free. And in the entire city, there are only 100 smoking facilities. And a lot of smokers criticize that these smoking areas are of poor hygiene and narrow. Many smokers have resorted to smoking in the back alleys. It shows that the Singaporean government and the South Korean government's tobacco control measures are much more draconian than that of Hong Kong's, but it did not affect their attractiveness in terms of tourism. On the contrary, they bring about good traveling experience with good air quality and cleanliness. If you are a smoker, if you want to choose a destination to travel, Hong Kong should be your first choice because we have the most relaxed tobacco control measures. Now, of course, for non-smokers, we have the safeguards to prevent you from inhaling secondhand smoke. So for smokers and non-smokers alike, we are the best choice. Now, I think smokers in Hong Kong enjoy a high degree of freedom. We have a very dense population, and so far we don't have any designated smoking area. This bill only prohibits smoking while queuing in outdoor areas, and also there is an expansion of no smoking areas at the entrance of hospital, care homes and kindergartens. Now the focus of these measures is to protect non-smokers from the impact of secondhand smoke. The 10 measures have not sought to address the issue of smoking while walking. I think this is something that we need to deal with down the road. Now, when it comes to flavored cigarettes, the government has given us a lot of figures concerning the harm of flavored cigarettes to young people, especially for young people who are contemplating to smoke. Flavored cigarettes would be their entry cigarettes. If we ban flavored cigarettes, I believe that the threshold to becoming a smoker would be raised. Now, for veteran smokers, they may complain about the ban on flavored cigarettes. Now, the government has thought of that. Sufficient freedom has been given to them. Smokers can still revert to the original flavor. It's just like ice cream. If chocolate flavor is not available, just choose the original flavor. So I fully support the government's proposed measures. For the way ahead, I think we need to strengthen the supporting mechanism for helping smokers and crack down on illicit cigarettes. There are many factors behind smoking, like curiosity, social needs, or emotional needs. To achieve the targets of lowering the prevalence rates further, it takes time. It will also take publicity and education. Support is also important. We should start with education by telling young people how harmful smoking is. We can prevent the birth of new smokers at source. We should also help smokers quit. President, I hope that in the very near future, Hong Kong can become a smoke-free city. That's our vision. Thank you. I so submit.
江玉歡議員。
Mr. Eng Kong, thank you, President. Hong Kong is one of the freest economies around the world. Our tobacco control measures are not just about public health issues. They're about the image of our city, economy, and personal freedoms as well. Our vision is to become a tobacco-free Hong Kong, but we need to think in a calm manner. How can we suitably strike a balance between public health, economy, livelihood, and personal freedom? The government has been introducing tobacco control measures in a proactive manner. The smoking prevalence rate has already dropped from about 20% to around 9.1% now. Right now, we have 10 tobacco control measures, 8 of which are implemented by legislation. In the second quarter of 2027, flavor traditional cigarettes will be banned in phases. Without doubt, smoking harms our health. There may be risks of heart diseases, lung cancer, and so on. Smoking will also affect children as well as pregnant women's health. Therefore, I completely agree with tobacco control measures being implemented in indoor areas. The bill covers acts of smoking while lining up as well as the expansion of NSAs. This will reduce the possible impact on the innocent. However, at the same time, we need to tread cautiously. We need to assess the possible economic and social challenges that come with these tobacco control measures. We are a highly marketized metropolis. We need to, at the same time, consider the cost of law enforcement, commercial laws, as well as the possible impact on the reputation or image of our city. If there's a lack of communication, the public might easily think that Hong Kong is not business friendly, or there is even excessive regulation of the city. Smoking could be construed as a kind of personal freedom. We need to strike a balance between the economy and public health. In other words, we do need to strike a balance between these two factors. We need to adopt a science-based approach as well. The administration said that strict tobacco control measures are conducive to improving the image of our city when it comes to tourism. I believe we need to back this up with economic indicators. At the same time, we shouldn't overlook the possible impact of the market of illicit cigarettes. We need to ensure that the measures are effective. I agree with most of the 10 tobacco control measures, but I have some reservation about banning flavored conventional smoking products. Many jurisdictions have different levels of tobacco control measures when it comes to heated tobacco products, e-cigarettes, and flavored cigarettes. Banning these products aren't a normal practice of a free commercial city. Nicotine intensity, advertisement channel. There should be efforts on this front. In 2016, the EU, first of all, banned menthol cigarettes, and in 2020, the ban was extended to menthol taste or menthol flavors. When it comes to e-cigarettes, there is strict regulation and ban. We have a high-intensity logistics network and tourism network. Against this backdrop, the administration should consider the possible impact on illicit cigarettes or illicit flavored cigarettes. Law enforcement actions will become even more difficult. heated tobacco products are considered by smokers to quit smoking. If this is taken too far, some smokers might not be able to quit smoking when they cannot fall back to heated tobacco products, and this runs counter to the original purpose of tobacco control measures. The key is to establish or formula policies that have taken into account the local economy, social culture, and the legal environment in Hong Kong. From time to time, we need to adjust the intensity and the direction of the measures. This will strike a balance between science and operability of tobacco control measures. This will also avoid undermining personal freedom in society. We need to adopt a macro perspective when we review the positioning of public health policies. In recent years, many people in Hong Kong care about their health. Therefore, the importance of tobacco control is necessary. We do need a tobacco control plan that carries more vision. When it comes to obesity issues, mental health issues, or support for dementia, there's a lack of resources. We need to reduce risks while we invest more in safeguarding our health. Take Singapore as an example. There's a national policy to encourage seniors to engage in skeletal training muscle training. There should also be diet support as well as mental health support. That is what we call an all-round support in this area. In conclusion, Hong Kong implements stricter tobacco control measures. This shows that the administration is attaching a lot of importance to this area. We need to recognize it, but we do need good policies in order to complement the measures of the administration. We need to keep enhancing the measures to be implemented by the administration. We need to tread cautiously. We need to be pragmatic. We need to strike a good balance between public health, personal freedom, and the local economy. That is exactly how we can achieve a win-win situation among different factors such as social consensus and tobacco control. I will agree with Mr. Peter Shill's amendments. If his amendments aren't supported by the Council, as the ban on flavored cigarettes are tied to all tobacco control measures, despite my support for some of the measures, I would choose to vote down this bill. I so submit. Thank you, President. Ms. Rebecca Chan. Thank you, President. In 2023, the smoking prevalence rate was 9.1%. It is very low when comparing with other jurisdictions. I agree with the general direction of the tobacco control measures. Some of these measures are aimed at further reducing the smoking prevalence rate so that we can become a tobacco-free Hong Kong. However, during the scrutiny of the bill, there have been heated controversies in society. That's why I'd like to draw the Council's attention to these controversies. The administration quoted the latest smoking prevalence rate. 63% of women smoke menthol cigarettes. About 7.4% of women smoke fruit-flavored cigarettes. Younger smokers tend to smoke flavored cigarettes. For those between the age of 20 and 29, about 72.9% of the smokers smoke menthol cigarettes, whereas 28.5% of these smokers smoke original flavor cigarettes. That's why the administration proposed banning the sale of flavored cigarettes in order to further bring down the smoking prevalence rate. I agree with this. The ban on flavored cigarettes will be implemented in 2 phases. The earliest is the second quarter of 2027. The first stage will target fruit-flavored cigarettes, whereas the second stage will focus on menthol cigarettes. For women and young people, they smoke menthol cigarettes. That is the most popular among them. Therefore, without doubt, I believe the effectiveness will not be as great. I understand that we need to start with non-menthol cigarettes. That is because fewer people smoke them. When it comes to the duty stamp regime, is it actually very effective in addressing the situation? The administration shouldn't rely on banning and regulating the situation. Instead, the administration should focus on providing incentives and encouraging people to quit smoking. We must consider encouraging smokers to quit smoking. Can the administration subsidize smokers to undergo medical checkups? What about lung examinations? We need to encourage parents to have a pledge with their young children to lead a tobacco-free life. These are just some examples. The gist is to provide incentives. We shouldn't just penalize smokers. We need to give smokers choices for them to quit smoking. These shouldn't be passive choices. For those below the age of 18, they could not be provided with smoking products. In the future, when you hand a cigarette to a minor, that is already not legal. I agree with this. I thank the administration for taking on board my view. One day earlier, that is better. We need to reduce the likelihood for minors to have cigarettes, and that is very effective when it comes to reducing the smoking prevalence rate in the long run. We need to reduce the harm of non-smokers. We need to protect them from secondhand smoke, especially children and seniors, starting from the 1st of July, smokers are not allowed to smoke within 3-meter perimeter from access points of specified premises, and that is only applicable to main doors. It might not be sufficient for us to protect children or students from smoking secondhand smoke. Some schools are on the ground. If there are smokers smoking nearby, then the smoke will drift into school premises, and it is likely that students will be affected. And I believe we need to designate the area that is 3 meters away from the entire school premises as no smoking areas. Of course, I understand that the administration needs to take into account the actual operability on these measures. That is because some smokers might be breaking the law easily. I hope that the administration will look into the situation and in reference to practice being adopted by mainland China. Say for shops adjacent to schools, they should be banned from selling cigarettes. This will better protect our students from getting in touch with cigarettes. I understand it is difficult to some extent for the administration to implement some tobacco control measures. That is, for a bus stop, even when you are just lining up alone, you cannot smoke. According to the administration, designating the entire bus or minibus stop areas as NSAs would ferment streets into many patchy NSAs. And I do understand it might be difficult for members of the public to abide by this policy. This may even cause conflicts between law enforcement officers and smokers. That's why the administration should keep reviewing the situation in the future. We need to reference the practice in use by Singapore. We need to have some pilot areas to implement the policy of a blanket smoking ban. This will better protect the health of the public, and this will also reduce conflicts when it comes to law enforcement. There is room for improvements in relation to the definition of indoor smoking. Say for some shopping centers in Meifu and Tsuen Wan, there's a canopy, but then they aren't confined spaces. For some public housing estate podiums, say for Nam Chung, residents go from Nam Chung MTR station all the way to housing estates. They need to go on to a footbridge. If there are smokers on the bridge, well, it is actually impossible for non-smokers to protect themselves from secondhand smoke. The administration replied that they would empower the secretary for designating a larger NSA in order to address the situation. But what factors will be considered in the future? Will the districts be consulted? Will there be any implementation timetables? Well, the administration was silent on all these areas. Will it be only applicable to large-scale activities? Well, I think it will be more pragmatic if legislators could relate the concerns and views of the public to the administration. This will be even more effective. When it comes to tobacco control, stricter measures won't yield better results. We need to encourage members of the public to quit smoking. At the same time, we need to make sure law enforcement actions are carried out in a proper manner. Tackle of the DH needs to implement measures and conduct patrols in a proper manner. We need to establish a long-term mechanism. We need to not just stabilize the smoking prevalent rate of Hong Kong, we need to further bring it down so that we can become a tobacco-free Hong Kong. Thank you.
Mr. Chun-keung, thank you, President. I speak in support of the Tobacco Control Legislation Amendment Bill 2025 to implement the 10 tobacco control measures. We all know that smoking is hazardous to us. We need to adopt a multi-pronged approach to lower the demand to supply of tobacco products so that members of the public will not be affected by second-hand smoke. We need to also step up smoking cessation services. As a member from the education sector, I'm very much concerned about the health of young people. There are heated cigarettes with fruit flavorings. There are more and more alternative smoking products available on the market. They come in different designs, and young people, as a result, was of the view that these smoking products are not addictive. It's easy for someone to pick up smoking. It's very difficult for anyone to quit. But the hazard brought about by smoking can cause lifelong issues. Fruit-flavored cigarettes have become more and more popular among young people. Some smoking products look like toys, and it's difficult for parents to know that those products are actually cigarettes. On the internet, we see young people abusing etomidate, and they look delirious, and they look like zombies on streets. We need to face up to this issue. It seems that there is a blurring line between smoking cigarettes and using dangerous drug. There are people who say that if we ban shisha, it will impact and undermine the experience of Middle Eastern visitors. However, actually, Middle Eastern visitors don't drink, and that's why they don't visit bars. However, in Hong Kong, most bars are the premises who offer shisha. There is a Islamic secondary school principal said that it's not a habit for Middle Eastern visitors or Southeast Asian people to smoke shisha. Regarding the proposed amendments from the two members asking the government to cancel the ban on flavored cigarettes and to adopt a positive vetting approach instead of a negative vetting approach, all these amendments will undermine the effectiveness of the 10 tobacco control measures. I do not agree with them. In March, an experienced LegCo member said that the goal of the amendment is to reinforce the bill, and they hope that the amendments will make the policy more effective so that the entire society will benefit. They are of the view that the bill should not be hijacked and changed completely. We should not lose our focus. End of quote. Although the occasion on which the members said those things are not the same as what we are discussing today, I think that the same applies. Smoking is a threat to global public health. We should not just look at the business opportunities brought by smoking and the sale of tobacco products. So I hope that after implementing the 10 tobacco control measures, the government will continue to review the effectiveness of them so that we can build a healthier future for our next generation. Thank you. Mr. SHIU Ka-fai. Thank you, President. The Liberal Party thank the Health Bureau for their tobacco control measures. Because the smoking prevalence in Hong Kong is just 9.1%, that's thanks to the effort of the government. Among the 10 tobacco control measures, we support actually most of them. Say, for example, introducing a duty stamp system for cigarettes to combat cheap whites. That's something that I suggested. Second, we should increase penalties for duty not paid tobacco. This is also my suggestion. On extending statutory no-smoking areas to the entrance and exits of specified places and increasing the fixed penalty for smoking offenses, I agree with them. Smokers should not affect others. We want people not to smoke when they queue. I support it. And I also think that we should ban people who smoke while they walk. I think that we should respect one another. That's why I support most of the measures. We should prohibit the provision of smoking products to a person aged below 18. I support that as well. We should adopt a plain packaging. Well, now we ask the tobacco manufacturers to put a warning that account for 80% of the area of the packages. No one is opposed to that. On banning flavored conventional smoking products, well, some people abuse dangerous drug by using vaping devices. That's unavoidable. But because of the prevailing policies, some people who smoke heated cigarettes don't want to come to Hong Kong. Of course, cigarettes is different from dangerous drug. Well, there are two other measures. We should strengthen smoking cessation services as well as publicity and education. Of course, we should do that. We should review the effectiveness of raising stamp duty. That's not a problem, but I will share with you some figures later on. I don't think that, however, we should ban flavored smoking products for the following reasons. First of all, flavored cigarettes are sold everywhere in Hong Kong, in the world. There are 50 countries, including Canada and UK. They've banned flavored cigarettes, and this is how they lowered the smoking prevalence in their places. However, they have not banned heated cigarettes or e-cigarettes. But as we have already banned heated and e-cigarettes, we're different from them. So what countries and cities ban e-cigarettes, heated cigarettes, and flavored cigarettes altogether? There are 5 countries: Mauritius, Sri Lanka, Turkey, Brazil, Ethiopia. If we pass this bill, then our tobacco control measures will be the same as those 5 countries. We'll become the 6 little dragons. Shouldn't we compare ourselves to other advanced cities? So I don't really get the logic behind this measure. Second, there are people who are worried that if we don't ban flavored cigarettes, then actually visitors can still bring along flavored cigarettes to Hong Kong. If people are willing to pay stamp duty, actually they can bring more than 19 sticks of cigarettes to Hong Kong. For people who are in possession of the packaging of flavored cigarettes, then they can smoke it in Hong Kong even if there's not duty paid. Are we encouraging people to go for illicit cigarettes? I think this goes against the government's intent because we don't want people to smoke. Over the past few years, the government is trying to lower the smoking prevalence to 7.8%. In 2023-24, the government raised the stamp duty 2 times from, to 31%, 31 point something percent. I can share with you some figures. In 2022-23, the stamp duty revenue is $7.93 billion. After raising the stamp duty, supposedly, given the daily smokers number remained unchanged, we should have a higher stamp duty revenue. However, in 2024-25, we only collected $4.25 billion. That's a drop of 45.5%, which means that we collected 45% less stamp duty revenue. Does that mean that the number of smokers dropped by the same percentage, by 45%? That's not the case. In 2022-23, we collect just $38 in terms of stamp duty per pack. However, now the stamp duty per pack is $66. However, back then we collected $7.93 billion. Last year we collected only $4.25 billion. That's a drop of 70% in terms of the absolute number of cigarette sticks. Has the number of smokers dropped by 70%? If that's not the case, where have the smokers gone? Last year, on the 29th of May 2024, we discussed the raise of stamp duty on cigarettes. Only 4 people were against it. I questioned the proposal. There were only 4 members who objected to the proposal. The government raised the stamp duty not to collect more stamp revenue. They wanted people to quit smoking. Did that happen? In fact, could be more and more people who pick up smoking because illicit cigarettes are cheaper. We support most of the tobacco control measures, but we have to look at what's happening around us, and we have to look at the illicit cigarettes market. We draft this piece of legislation which will entail more enforcement actions to be taken. I have great reservations about this particular measure. If we banned flavored cigarettes, does that mean that it will disappear altogether? Mr. Chun-keung will talk about his amendment. Some people say that if you put some extra elements to conventional smoking products, it will produce some flavors. So it's actually impossible for you to ban flavorings being added to cigarettes. I think that we should ban e-cigarettes instead of heated cigarettes, because for heated cigarettes you have to add some liquid with unknown sources. That's very dangerous. If we ban flavored cigarettes in Hong Kong, then it will give rise to a black market. I've talked to many members on the situation of illicit cigarettes. Are we pushing smokers to purchase cheap whites? We just talked about a betting duty on basketball. We all think that gambling is wrong. We all think that smoking is wrong. But it seems that we think that we should legalize betting on basketball so that we can drive illegal gamblers to the legitimate market. If the same logic goes, then we should not ban flavored cigarettes. Because if we ban it, then we're driving people away from a legitimate market to the black market. Thank you.
Mr. Michael Lee. Thank you, Deputy President. The government introduced this bill to implement 8 out of 10 of the tobacco control measures. That includes stamp duty, a duty stamp system for paid cigarettes, prohibiting smoking while queuing, and prohibiting possession of ASPs, and so on. I support most of these measures, and I applaud the government's work on tobacco control. We are all very familiar with the slogan, "Smoking is bad for health." Now, I still remember in an advertisement back in the 80s, a famous actor told us, "Don't smoke." The image is still fresh in my mind. Smoking would cause various diseases and cause a lot of financial burden in society. Compared with 1982, there were some 1.2 million smokers. In 2010, there were only 700,000. The decrease was 500,000. According to the latest figure, there are 580,000 people who smoke daily, accounting for 9.1% of the population. The number has really dropped. When I watched football game at the Hong Kong Stadium when I was a kid, there were still tobacco manufacturers sponsoring the matches. There were smokers everywhere, in restaurants, on buses, even in hospitals. Non-smokers were made to become second smoke inhaler because there were people holding a cigarette on the streets everywhere. And nowadays, there are no more cigarette advertisements. The WHO has mandated warning signs on packaging to enhance the deterrence. Starting from 2007, all indoor areas and all indoor offices and most public places became no smoking areas. The no smoking area expanded to public transport interchanges, and now with this bill we are extending the NSAs to 3 meters areas outside of entrances of schools, care homes, and so on. I support it. Now, starting from 1994, people under the age of 18 could not buy cigarettes. Now we are expanding the prohibition to ASP. I support it. Now, in the past, the amendments were universally supported by teachers, students, and even the business sector. But there is one thing we must consider. Is the government trying to ban cigarettes outright? If not, why is the government implementing an across-the-board ban on flavored cigarettes? If we banned flavored cigarettes, can we lower the smoking prevalence rate effectively? Mr. Peter SHIU just gave us the figure. I think this is not the effective way to do it. So at the CSA stage, I will share with you some examples where other governments respond flexibly. Now, I must say that the 8 measures can function independently. We don't need all of them. I think the ban on flavored cigarettes is against the overarching principle. The government is binding all the 8 measures into one. The prohibition on flavored cigarettes is not necessary. If you play Tai Chi, you will still get the health effect even if you skip one set of exercise. So I hope we can cancel this measure. We should give choices to smokers. Otherwise, they will be driven to buying illicit cigarettes or cheap wines in the black market. This is not something that we want to see. It is all about the availability of options. Now, tobacco, alcohol, dangerous drugs, these are all harmful stuff. But we all know that oily food, salty food, and sugary food is harmful. So that's why the government established a committee to reduce the content of salt and sugar and oil in food. More people want to have healthier food, but there are still people who like to eat fatty food and oily food. That's because everyone has choice. After considering your personal risk, one may decide whether to eat unhealthy food or not. Now, I agree with most of the measures in the bill. I agree with increasing the penalty level of selling or buying illicit cigarettes and also prohibiting smoking in queues. Well, actually, smokers are very self-disciplined. If they want to smoke, they would hide in a corner or in the back alley. After smoking, they would clean after themselves. They would take away the cigarette butts. I saw some female smoker who smoked with a pincher so that the smell of the smoke of the cigarettes will not remain on their fingers. That is a great cultural change compared with the past. So besides extending the NSA on non-smoking areas, we should learn from places like Japan. We should create smoking room in shopping malls and other places so that smokers and tourists can smoke without affecting others. I support the other measures, including increasing the penalty level for illicit cigarettes. According to an independent survey, in 2025, the proportion of illicit cigarettes has increased to 60%, including duty-not-paid cigarettes and cheap rice. Some of them are flavored cigarettes. So the government should not just control legit cigarettes, because you would exacerbate the problem of black market. If we ban heated tobacco products, e-cigarettes, vapes, and flavored cigarettes in one go, it will only drive more smokers to the black market. In terms of government's tobacco control measures, I wonder if the government has reached a bottleneck. I know that nicotine and other harmful substances are bad. So maybe we should ask cigarette manufacturers to lower the harmful contents in cigarettes like tar. If you want to help someone to quit drugs, you need to give them methadone. So has the Secretary for Health considered introducing popular alternative products from the world care teams should be asked to give out these products to help smokers reduce the consumption of cigarettes gradually, or even quit smoking altogether. Besides, the care teams can gather information concerning the smoking habits of smokers and help the government plan the next step. Now, I know that many smokers are using e-cigarettes and heated tobacco products and flavored cigarettes as alternatives to conventional cigarettes. They want to quit, and these are their intermediate help. So I really think the government should reconsider their position. Concerning prohibiting smoking while walking, in my constituency, that is Taiwan, there is a footbridge leading to the PTI. Whenever I walk on the footbridge, there are always people holding a cigarette in their hand while walking. I became a secondhand smoke inhaler every time I walk on the bridge. This is something that we really need to address. That's all for me now. I will continue to explain my committee stage amendments, that is deleting Section 9 and all the provisions in relation to flavored cigarettes. Thank you. Mr. Ka-fai. Thank you, President. I'm a member of the Bills Committee. I speak on behalf of the FTU. Concerning Tobacco Control Legislation Amendment Bill 2025, I give our support. Tobacco control has a positive impact on personal health and public hygiene. It is important in protecting the public. The amendments in the bill seek to enhance tobacco control measures and further minimize the harm of smoking on the public. Whether it is the health caused of smokers and also the health caused on non-smokers who inhale secondhand smoke, this bill will definitely help. The FTU has always supported the government to create a smoke-free environment to protect the next generation from the harm of tobacco. Concerning Mr. Peter SHIU's proposed amendment, that is introducing a positive vetting mechanism for the measures, the FTU objects to it. Formulating subsidiary legislation has been an effective way to balance predictability and flexibility. Now, even if it is an active vetting process, there is still room for debate by members, and it will not undermine the Legislative Council's supervisory role. Now, in the future, the government would consult the trade first before introducing amendments. By way of negative vetting, there will be sufficient time for the trade to prepare themselves. So the trade will have sufficient time to dispose of their remaining products and react to the change. Concerning Mr. Michael Lee's proposed amendments, that is deleting the prohibition to sell flavored cigarettes, the FTU also objects to the proposal. I think the government has listened carefully to public opinion and has made some necessary changes. Menthol flavor has been set aside and has been given different treatments compared to other flavors. Now, according to a joint research conducted by the Hong Kong Council on Smoking and Health and the HKU, more than half of the respondents has an habit of smoking flavored cigarettes. Among women between the age of 15 and 29, 86% of them smoke flavored cigarettes. There are a wide variety of flavors, and the flavor would weaken the original flavor of the cigarettes. Now, among those who smoke flavored cigarettes, 36% of them are heavy smokers. The percentage is much higher than young people who smoke original flavored cigarettes, that is just 16.7%. It is easily understandable. If it tastes good, why don't I smoke more? So I think if we cancel all the provisions in relation to banning the sale of flavored cigarettes, it would seriously undermine the overall effect of our tobacco control measures. It would exacerbate the problem among young people. On the other hand, the FTU is highly concerned about the behavior of smoking while walking. Now, the bill does not address this issue, but this is also a serious public nuisance. As other members have rightly pointed out, we are parents, and when we bring our children out, there is no way to avoid the smokers. Now, according to a public consultation, more than 60% of respondents supported banning smoking while walking. It would make the streets cleaner and also give better protection to the rights of non-smokers. The FTU will closely follow up on the progress of this matter. We urge the government to carefully study regulating this behavior. The FTU is also concerned about the enforcement of the bill. The measures in this bill are key to breaking through the bottlenecks of smoking prevalence rate. It will help us achieve an even lower smoking prevalence rate. The FTU supports the government's direction in tobacco control, and we support the healthy development of society. The government must step up efforts in publicity and education to ensure that society understands the latest requirements to prevent the public being caught unwittingly in the net. And also, joint operations should be conducted between the fire service departments, the FEHD, and the Departments of Health to ensure better collaboration. Resources should be used more effectively. The FTU is also concerned about the usage rate of smoking cessation services. Now, the government has set up hotlines, mobile clinics, and also smoking cessation center. However, the usage rate is on the low side. According to a 2023 survey conducted by the CNSD, there were some 630,000 smokers in Hong Kong. 82% of these smokers said they were aware of smoking cessation services, but only 30% of them had used the services. It shows that we need to extend the reach and scope of these services. So, while implementing the measures, we should also provide sufficient supporting services in district health centers, hospitals. In the future, we should also set up smoking cessation clinic so that smokers who would like to quit can get the support they need. Once again, I support the measures in the amendment bill, and I fully support it. Thank you.
Dr. Dennis Lam. Thank you, Deputy President. The Tobacco Control Legislation Amendment Bill 2025 is aimed at lowering the smoking prevalence rate to help Hong Kong to move towards a tobacco-free Hong Kong. I support the 10 tobacco control measures, and I believe there is still room to enhance the tobacco control measures. One, we need to ban the act of smoking while walking. We also need to designate walking bridges to plaza as non-smoking areas. Starting from the 30th of April 2022, Hong Kong has already banned the import, promotion, sale, and transaction of ASPs, but existing legislation has some loopholes. Accommodate may be used as tools to consume dangerous drugs. The abuse of such a substance has everything to do with the existing situation. Ordinary people might find it difficult to confirm whether one is consuming dangerous drugs. That's why we have seen scenes of people suspected of smoking dangerous drugs in the streets. Upon the passage of the bill, the police can immediately take law enforcement actions when they see people using vaping devices in the streets. We may reference Japan and Thailand. Long ago, they have already banned ASPs, and this is effective in curbing young people from abusing drugs. The bill also covers other prohibitions. I support the provision that bans smokers from smoking when the line has more than 2 people. But I hope that there will be regulation over the act of smoking while walking. According to the public consultation conducted by the government, as much as 85% of members of the public interviewed support regulation over the act of smoking while walking. This reflects significant consensus in the community. Despite difficulty in law enforcement, we do need to enhance deterrence effect by passing down legislation in this regard. Some footbridges don't meet the criterion of 50% of the total gross floor area. That's why they aren't designated as NSAs. However, for some covered footbridges, there's a lot of footfall. Say for the United Center footbridge in Admiralty, it's semi-enclosed and it's not designated as an NSA. However, there are a lot of pedestrians using that footbridge. I hope that the administration will designate all covered footbridges as NSAs in order to protect the health of seniors as well as children. The bill prohibits flavored tobacco products from being sold in Hong Kong. However, there's no ban on tools for one to self-make flavored cigarettes. These could be procured easily online. People can add flavors to achieve the effect of flavored cigarettes. The administration may consider enhance the effectiveness of the 10 tobacco control measures by regulating this act as well. These measures are very important when it comes to moving Hong Kong towards a tobacco-free one. This will help members of the public to live in a smoke-free city. I speak in support of the bill. Does any other member wish to speak? Mr. Paul Tay. Deputy President, for all these years, I've made my position on tobacco control very clear. Just now, Ms. Doreen Kong also said something similar in relation to striking a balance. I'm not going to belabor the same point. However, I'd like to raise 1 to 2 points. I'd like to supplement 1 to 2 points. That is because this bill is a new one. I'm not a smoker. I don't encourage people to smoke. And I do think secondhand smoke affects non-smokers. These are cliches, and I'm not going to repeat all these. Just now, Mr. Kwok Wai-kang or Mr. Michael Lee talked about another point. Mr. Charles Ho, before he passed away, made an appeal in public. I'd like to talk about governance in society. Of course, we need to encourage members of the public to help build Hong Kong into a tobacco-free Hong Kong. We may do so by way of legislation if it is not possible to persuade them. Hong Kong is a free society after all. Smoking, political leanings, economy, well, actually freedom is one of the most important cornerstones, except the rule of law. We shouldn't be helicopter parents when we educate our children. I don't accept this practice. It's a matter of degree. It's a matter of choice, as some members put forward just now. We are adults. We know very well these. It's about the degree of the regulation or education when it comes to children. We shouldn't go to extremes, but of course, I don't think the administration is doing so in this case. However, when it comes to tobacco control measures, I think the administration is going to extremes. For serious offenses, strictly speaking, we might be able to reduce the crime rate to close to 0%. What can we do? A curfew? Yes. Then many fewer people will commit offenses, but that's not possible. All around the world, we cannot do so. From the economic point of view, we have the law of diminishing marginal returns. 9.1% to 7%, no matter how strict the measures are. The marginal returns will diminish. That is the fact. And we do need to be flexible. We need to be flexible when it comes to making adjustments. We shouldn't rein in the act of smoking too strictly. When I watch movies, before capital punishment is administered, the inmate is given a cigarette to smoke. We need to keep breathing space for people in society. There are many different practices in other jurisdictions. The administration made reference to Canada. They said that this is a good example to follow. They actually have other outlets. Say they don't have any bans on flavored cigarettes, heated tobacco products. In one of the examples, in the British Columbia province, starting from the 21st of January 2023, they started a pilot scheme for serious drugs, including cocaine, as well as other substances. They have legalized when the weight is below 2.5 grams. Just now, Mr. Michael Lee said that we do need an outlet, and that also applies when it comes to drug addicts. I will supplement my views on flavored cigarettes in a moment. There is logic asymmetry. This morning, Mr. Peter Hsu talked about the issue of betting duty in another bill. The logic is different. We're lowering the wine duty, but then we are not banning smoking. Actually, we have minimized the harm of secondhand smoke close to zero. When one drinks, it doesn't mean one is drunk, but there are a lot of cases of drink driving. A lot of these cases are fatal. They even claim the lives of passers-by. Well, it's not always about logic as legislators. Sometimes we need to have regard to the actual situation. All right, going back to the bill, I'd like to supplement 2 points. In relation to flavored cigarettes, we use Canada as an example to follow. Just now, I said that we need to be flexible. There's a holistic approach for Canada to handle the issue of smoking or cigarettes. There is counseling, there is group counseling. They don't impose any blanket ban on flavored cigarettes. When it comes to the definition of Appendix 10, we have already provided a lot of views. The administration said that cigarettes have decades of history. Cigarette manufacturers have all these figures, but after all, these figures are just figures. We do need clear legal definition to define what makes a conventional smoking product. You cannot just say when you add something to the existing cigarettes, then you break the law. Say X, let it be the content of the conventional smoking product. If there is anything more than X, then you break the law. That will make law enforcement actions very difficult. You will have to rely on science. Cigarette manufacturers will have to report on the contents of X or the substance, and that will lead to a lot of different problems. Going back to the example of Canada, it's very successful. When it comes to law enforcement actions, have they prosecuted anybody in Canada? Well, the answer is no. They just persuade manufacturers to follow the guidelines. There wasn't even any prosecution. So in Hong Kong, are we going to adopt the same practice? Regarding flavored cigarettes, the method, intensity, implementation logic, there may be different problems. So I tend to agree with Mr. Peter Shield and Mr. Michael Lee. Next, I'd like to talk about the scope of NSAs. Public transport facilities, public places is actually quite easy to designate NSAs. These areas are smaller. However, for these 10 tobacco control measures, there are a lot of different patchy NSAs. Say several meter perimeter, several feet. Well, I asked the officer responsible for these measures. I told them, well, don't read the guidelines, just tell me. Tell me off the top of your head. It's quite difficult. Not to speak of for ordinary people. They may have to call up the lawyers to ask. I hope there will be clear signage in the future. When there are more regulations, when there are more bans, why don't you just impose a blanket ban? Why don't you just put in place some smoking areas, say smoking rooms, smoking chambers? This will be more effective and for members of the public to follow. Thank you. I so submit. Does any other member wish to speak? If not, I now call upon the Secretary for Health to reply. Then the debate will come to a close. Secretary. Deputy President, I thank members who spoke in support of the bill. To support the Tobacco Control Legislation Amendment Bill 2025. It is aimed at implementing the new phase of tobacco control measures. The resumption of the second reading debate today reflects constructive executive legislative interaction. In June last year, the administration proposed 10 tobacco control measures. We consulted members on their views. Before first reading, we have incorporated many suggestions into the bill. The Bills Committee held a total of 8 meetings. I'm grateful to Chairman of the Bills Committee, Mr. Holden Chow, and other members of the Bills Committee for their full engagement, valuable views, and constructive suggestions. We share the same resolve to implement tobacco control in a step-by-step manner. The aim is to protect the public from tobacco harm in a well-rounded manner. Members, especially from the DAB, in particular Mr. Leung Hae, expressed concerns over the commencement date. As explained in the course of the scrutiny of the bill, we will introduce measures in an orderly manner. We will also consult the Council on implementation details and commencement date according to the established mechanisms. We will also put in place reasonable transitional periods for the public and the trade. We have adopted the committee's recommendations. We also maintain close liaison and interactions with members. I have to thank members for giving us their views, which have improved the bill. They have provided views in relation to the practice in use by Canada and the prohibition from providing tobacco products to persons aged below 18 and to allow manufacturers to deal with storage in order to clear up the misunderstanding by the public. In a moment, I will expand on these details. Some members will move their CSAs. I have to point out the CSA will weaken tobacco control of the administration. At the stage of the Bills Committee, the administration already explained the possible impact on these amendments to be moved by members. And I will give you more details in relation to these areas. Tobacco products kill over 8 million people a year worldwide. Among them, some 1.2 million people are killed owing to secondhand smoke. 1 every 2 smokers dies prematurely. These are not just cold figures. There are numberless broken families. These are the reality. In fact, there are still about 580,000 smokers in Hong Kong. Smoking causes severe diseases. As a Secretary for Health and as a former frontline doctor, I have witnessed all too many tragedies that could have been averted. Lung cancer patients fighting for breath, stroke patients with trembling hands, families driven to despair by sudden cardiac deaths. Tobacco inflicts harm on patients and their loved ones. Smokers often regret it when it is too late. 4 decades ago, a famous person died, and Mr. Charles Ho passed away lately. Their sharing touched us. All of us mourn their death. All of us are angry at the harms of tobacco products. Second-hand and third-hand smoke affect the innocent. When smoke drifts near children, we lose not only health, but also our future. Tobacco control is about respecting life, and we need to safeguard our future generations. Smoking is detrimental to health, and health is wealth. Local research estimated that in 2021, tobacco-related health problems cost Hong Kong about $8.2 billion annually. If we allow tobacco harm to spread, the economic loss will only grow. Smoking is the most preventable public health threat. With a double whammy of chronic diseases and an aging population, strengthening tobacco control is not optional, but it is essential. To achieve our vision of a tobacco-free Hong Kong, our overall strategy is science-based and consensus building. drawing on evidence and successful overseas experience, in 2023, we proposed 4 directions for the new phase. They are regulate supply and suppress demand, ban promotion and reduce attractiveness, expand NSAs and mitigate harm, and enhance education and support cessation. Public consultation has started. It showed 90% of Hong Kong people supported further lowering the smoking prevalence rate. A tobacco-free Hong Kong is now the mainstream aspiration. The government has carefully assessed the effectiveness, operability, and public acceptance. We announced a package of short, medium, and long-term measures last June. We listened to different quarters of society, including a lot of legislators in the chamber today, to refine the details. We have incorporated your reviews into the bill. Well, there are different measures mentioned, such as the plain packaging, as well as the duty-paid stamp regime. It will be implemented by way of negative vetting. Commencement date will be set down later on in order to make it flexible. We banned the possession of ASPs in phases to allow the possession of ASP devices in the first phase in response to Mr. Peter Shiu of the Liberal Party. In addition, in order to address the concerns of legislators of different parties over the flavor cigarettes ban and illicit cigarettes, we will introduce measures for combating illicit cigarettes before banning the sale of flavor cigarettes. We will adopt a 3-pronged approach to combat illicit cigarettes. These measures will take effect immediately after the gazettal of the bill. In the first phase, we will ban non-menthol cigarettes, and we will also continue to allow members of the public and visitors entering Hong Kong to bring flavor cigarettes with them for their own use. The bill we introduced to the Council is a package of tobacco control measures which have absorbed views of the Council and society, and which protect the health of the public. These measures help us to advance towards the vision of tobacco-free Hong Kong. The Bills Committee invited submissions on the bill from the public. During the deliberation of the Bills Committee and the debating on the bill just now, some members and groups are worried that the measures might affect the economy and tourism. In fact, tobacco control and the economy are not a zero-sum game. I must reiterate that tobacco control will bring us good health without compromising the economy. Among the submissions received by the Council, over 30 submissions came from deputations and professional bodies. They reflected tobacco control is not at odds with boosting the economy. In 2007, the trade was worried the expansion of NSAs will affect their business receipt. Their business might be in a slum, that is a worry. However, their business receipt actually went up instead. That shows tobacco-free restaurants are actually quite attractive to some patrons. They have successfully drew some patrons to their restaurants. We have already said that tobacco control would not affect the local economy. The appeal of a real metropolis lies in the sense of happiness the public feel from clean air and inequalities of a city. Furthermore, tobacco control is a global trend. From indoor smoking bans to flavored cigarette bans, our 10 measures for tobacco control are not going to extremes. We aren't seeking to win at all costs either. The truth is that Hong Kong needs to catch up. On a different note, in response to the views on implementation expressed by the Bills Committee, the DH will issue implementation guidelines for the new offences and put in place interdepartmental coordination and liaison mechanisms to ensure smooth enforcement. Before the introduction of the measures, we will also step up public explanation. We will maintain close liaison with the tourism sector and strengthen publicity and promotion of these measures to visitors through different channels. If this bill is supported by members, this will provide a legal basis for the next stage of tobacco control measures. We prioritize combating illicit cigarettes for us to yield results. We need to protect our younger generations from smoking. Banning the sale of tobacco products to people aged below 18 will take effect immediately. There will also be non-smoking areas to protect the feeble, the old, and the young. And the fixed penalty will also increase to $3,000. NSAs and a new penalty will take effect on the 1st of January 2026. The ban on ASP has been in force for 3 years. However, some members of the public are still exposed to these ASPs. Accommodate is one example. Starting from the 30th of April 2026, we banned the possession of ASP substances. In the third quarter of 2025, we will roll out the pilot scheme of duty-paid stamp duty regime. The purpose is to implement it in conjunction with the plain packaging starting from the second quarter of 2027. Flavored cigarettes are simply a poison chalice. And we will also be banning flavored conventional smoking products or tobacco products. Aside from these legislation measures, I'd like to say that promoting smoking cessation is also a key pillar of our tobacco control strategies. We have been making efforts to promote smoking cessation and health education. We have provided more types of cessation services, set up more service points, and increased quotas. We have also worked with the education sector to raise students' awareness of the harms of smoking and to foster a tobacco-free atmosphere. Ms. Rebecca Chen and Ms. Lillian Kwok have expressed concerns about students and cessation support. We will further strengthen cessation services, including exploring how to make better use of district health centers and a family doctor network, so that smokers who want to quit smoking can find the most suitable and convenient ways to do so, and stepping up education and publicity for students. As I said when moving the second reading of the bill, tobacco control is like sailing against the current. If you don't advance, you drift back. It requires concerted efforts across generations and sectors. There is no home stretch in tobacco control, but we can achieve a significant milestone today together. I urge members with sincerity to think of our next generation and think about their well-being. We need to respond to aspirations of our society. Please support and pass this bill and the amendments I will be moving in a moment. I so submit. Thank you, President.
I now put the question to you that the Tobacco Control Legislation Amendment Bill 2025 be read the second time. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Tobacco Control Legislation Amendment Bill 2025.